Good evening, everyone. Welcome to our assessment for CAA aspirants. We are actually now on our 16th week or week 6 of module 2, all about diagnostics. So let's start the ball rolling. I would like to assign the first 5 questions to the earliest bird, Ma'am Angel. 1 to 5 po. Good evening, Ma'am Angel. Let's start
Good
po.
evening, Doc. Good evening, classmate.
Hmm.
So, number 1. A young woman comes to your office complaining of a cough that does not go away. As you question her, you discover that her cough began 4 months ago with a flu that kept her in bed for 3 weeks with a high fever, constipation, and a red rash. All of her symptoms are now gone except for this cough, which is very painful for her. She complains of feeling gloves. Yung gloves po is thick lump na sticky, of sputum stuck in her throat and chest, but she can't seem to cough them up. Her face appears slightly flushed and she gets thirsty easily. Her pulse is slightly rapid and slightly tready. Which of the following tongue appearance would you expect to find in this case? So, yung gloves po is sticky lump. So, automatic po ay phlegm po siya. So, yung A po natin is red body with a white moist greasy coating. B, pale swollen body with a white greasy coating. C, red body with a thick dry yellow coating. D, pink body with a dry white coating. So, answer ko po is letter C. Kasi po, meron po siyang thick dry yellow coating. Dahil ano po siya gets thirsty easily. Tapos yung pulse po niya is rapid. So, ibig sabihin, may heat po siya.
Okay. So may heat, red din yung body.
Yes po. Yes
So
po.
ano po yung
Tapos,
ating
easily thirsty po.
Okay, Ma'am Angel, ano po yung ating
Yes po, Doc.
diagnosis dito? What is the
Um,
TCM diagnosis? Okay,
ano
tingnan
po,
natin
yung
yung mga
explain po niya.
keywords. Okay, wala tayo mag-ano ng kasi you need to have a diagnosis for you to be able to really um, imagine how the tongue would look like. Ang pinakita lang dito is slightly rapid pulse and slightly
Yes
thready.
po.
Okay,
Ready.
slightly rapid, there's not too... Okay, and this is a very old problem. Not so old, rather. High fever, constipation, red rash. Ito po yung manifestations of heat, no? So, would you like to agree that this is basically phlegm heat? Kasi
Yes,
sabi
Doc.
mo gloves is phlegm.
Kasi, phlegm po siya, Doc. Tapos, kaya po napili ko po yung, yes po, yung letter C, dry yellow coating po yung,
Yeah, at saka
atik dry yellow coating.
tinan mo yung the face appears slightly flushed and
Apo.
she gets thirsty easily.
Easily.
At saka kung napansin nyo she was in bed for 3 weeks with a high fever, constipation, and a red rash. No? And then yung kanyang ubo ngayon is a bit painful. So it's mahirap ilabas. Okay?
Apo.
Meron siyang feeling globs of sputum stuck in her throat and chest. Okay. So we did not answer letter A because in the white moist greasy coating is not heat, right?
Yes po.
Okay. Pale swollen body with a white greasy coating. Okay.
White po ulit.
So, okay. The best answer is letter C.
Is letter C po,
Okay,
Doc.
very good. So, yon. Next, number 2.
Number 2, a 35-year-old male has suffered from chronic colitis characterized by inflammation of the inner lining of the colon. Bali ano po to chronic digestive disease po siya na inflammation. So, over the past 6 years, His symptoms include loose stools, poor appetite, bloating after eating, and periodic nausea. Which of the following tongue condition would you expect to find in this patient? A. Freckled tongue with a yellow coating. B. Red cracked tongue with a thin yellow coating. C. Thin and small tongue body with a thin white coating. D. Slight pale tongue with teeth marks and a greasy white coating. So, ang answer ko po is letter D. Kasi po yung may teeth marks po siya eh. So, nakikita po natin yung teeth marks po pagka may problema po sa digestive system, which is may kinalaman po kay spleen. So, hindi po siya letter A kasi yellow coating po is heat.
So paano mo nalaman na meron siyang digestive ano? Like ano ba yung ano dito oh? Tingnan niyo. I think this is the one.
Chronic colitis po kasi is ano
Okay.
siya, digestive disease po siya. Inflammation po siya of inner lining of the colon. So, yun po yung nakita ko. Tapos may loose stool po siya. So, may digestive problem, poor appetite, may bloating po siya after eating. Tapos, yun po. Kaya, letter D po yung answer ko po.
Okay. Ano po yung TCM diagnosis nyo dito?
Meron po siyang parang spleen deficiency, spleen chi deficiency po.
Okay.
Or yin deficiency po.
So itong chronic colitis niya, this is a very old problem, no? 6 years. So it's very chronic. So meron na talaga siyang. Okay. Yeah. Kung napapansin nyo, mukhang ano, we cannot answer yellow coating, thin yellow coating, because wala po siyang heat, no?
Yes po.
At saka, bakit hindi mo sinagot ang thin and small tongue body with a thin white coating?
Yung ano po kasi, yung thin and small tongue body po, ano po siya, usual po blood deficiency or chi deficiency. Pero more on
yin
pwede ring
deficiency.
normal.
Okay. Pag thin kasi yung tongue body, you would always think na it could be yin deficiency or blood deficiency, and you wouldn't normally see a thin white coating, no? Thin and small. Okay, so the best answer, kasi sabi mo, is the diagnosis would be spleen chi deficiency. Yeah, slightly pale tongue with teeth marks. The teeth marks are very indicative of a chi deficiency. So samantalang itong C could mean either yin or deficiency or blood deficiency, which we don't see in the patient. No, loose stools, poor appetite, bloating after eating are all signs, and periodic nausea. Okay. Okay. Spleen and stomach. So stomach. Okay. Kasi ganito po yan, no? I think may kinalaman talaga, malaking kinalaman yung chronic colitis, no? Over the past 6 years. And alam naman natin na the same polarity po yung large intestine or the colon with the stomach, which is actually the partner of the coupled organ of the spleen. Does it make sense? Any comments? Any violent reaction? Okay. So yun. So in this case, we should always be treating not only the colon. Okay? Kailangan natin ma-treat din po yung ito po yung classic example where one organ will actually affect all the other organs. So you have to be very familiar with your channels. Okay? So alam naman natin na ang large intestine and stomach, yang ming po yan. Diba? And yung colon, large intestine. Diba? Yang ming. And pag yang ming, sobrang, yang ming, bright young. So, interiorly, exteriorly related yung stomach sa yung stomach sa spleen. Okay? Did that make sense? Stomach na stomach o periodic nausea, spleen. Di ba? Okay, so let me see. Another reason would be you have a metal element. Okay, metal is the child of the earth element, right? Can you see the connection now? Earth is stomach and spleen. So nag-umpisa siya, mahina po yung metal niya, no? Large intestine, colon. And eventually, the mother will come to the rescue, tutulong. Okay, what happened? Affected. And remember, pag affected yung stomach, syempre large intestine eh. Can you follow? Are we clear?
Yes, Doc.
Yes, Doc.
Yeah, very good. So, siguro naman by this time, 16 weeks na po tayo, you would have already mastered the 5 elements, no? We kept repeating the importance of the interrelationships, and we have tried to be familiar with the channels, no? Hindi yung mga puro organ lang yung gusto ko yung yung polarity, katulad po nito, yang ming or bright yang, ang magkasama dyan would be the stomach and the large intestine, right? So if the large intestine is affected, eventually the stomach will be affected. And the stomach is supposed to be the earth element, and it just so happened na superhina na ng yang, kaya nakakoncentrate na tayo sa yin. Okay? Yan. Nakita nyo? Humina na po yung yang. Okay, let's go to number 3. Ma'am Angel, please.
Number 3. Simon, age 31, complains of impotence and inability to maintain an erection for more than 1 minute. He also complains of exhaustion, cold hands and feet, and loose stools. Upon examination, you notice that he has beads of sweat on his forehead. He says he sweat very easily during the day with the slightest exertion. He also complains of diarrhea in the early hours of the morning at least twice a week. Additionally, he is being treated by Western doctor for bronchial asthma. He currently uses a steroidal inhaler because of his difficulty inhaling. What kind of tongue and pulse would you expect to find in Simon at this time? A. Red tongue body with a yellow coating, wiry and rapid pulse. B. Pale tongue body with a yellow coating, slippery and wiry pulse. C. Pale tongue body with a thin white coating, deep and deficient pulse. D. Pale tongue body without coating, soft and deficient pulse. So, ang answer ko po, Doc, is letter C po, Doc. Yung pale tongue body with a thin white coating, deep and deficient pulse. Kasi po yung deficient pulse po is chi and blood deficiency po siya. So, parang nakikita po natin yung deep pulse naman, yin organ parang deficient po. So, may pagka-yin deficiency po siya, Doc.
Are you yin deficiency?
Yeah, up po. Hindi, ano po, yang deficiency po kasi cold hands and feet po.
Wait lang. Yung ano niya kasi, ganito. Tignan mo, yung palang the inability to maintain an erection is already a deficiency. Now, we need to determine, ano ba to? Is it chi deficiency? Is it yin deficiency? Or is it blood deficiency? Doon na lang po tayo sa dalawa because I don't see any issue connecting this to any symptom that would tell us it is blood deficiency, right? Okay, so ang pinaka ano dito is Can you see this? Sweats very easily during the day. No? Sino ba dito nakaka-relate?
Opo.
This is so, so important. With the slightest exertion.
Opo.
Yeah, I can actually relate to this, but and then another is diarrhea in the early hours of the morning. So this is definitely spleen and kidney, remember? Diba?
Spleen.
Kailangan po ng spleen ang
Spleen and kidney yang deficiency.
yes. Kailangan po ng so pag mahina po ang kidney yang, definitely affected ang spleen. So ito yung tinatawag nilang cockscrow diarrhea. So looking back, there's exhaustion, cold hands and feet. Huh? Ito pa lang, this is so important. Cold hands and feet, loose stools, cold. So we're looking at yang deficiency, right? So let's take a look at the choices. So we cannot answer this one, letter A, because rapid ang pulse, right? Wala tayong nakikitang heat. And also this one, yellow coating, slippery, wiry pulse. Bakit po ito mali, Ma'am Angel?
Kasi po ano po slippery and wiry pulse.
Pag
So,
wiry pulse ba, ano
may
ba yung nasa
coating,
utak natin?
yellow coating po. Kung may yellow
There's heat.
coating po, is heat po siya.
Very
Opo.
good. And why is this letter D not correct?
Kasi po without coating po siya.
Okay.
So,
Ano
empty
ba?
heat po.
Ano kaya ang nangyari if you have a pale tongue body without coating? What do you call that deficiency? Okay, ganito ha. Ang tanong ko na lang ganito. Alam ko, you know the answer. Do not be so ano naman. Alam ko, inaral mo to. Problem ng patient, madali siyang pawisin sa morning, even with slightest exertion. And remember, he's only 31. Okay? And, ano pa? And also, meron siyang, asthmatic siya. Naka-steroidal inhaler siya. So, we would look at what? Kidney and lungs, right? Do you agree? So,
yes po. Kasi may bronchial asthma.
yeah, and also, meron ditong loose stools. So, spleen, right?
So, may spleen.
So, are we talking about spleen qi deficiency or spleen yang deficiency? Cold hands and feet.
Spleen yang deficiency
Okay.
po.
If the spleen is affected, eventually, what will be affected as well? Sino ba yung kapamilya?
Yung lungs po.
Very good. And this is what we call the hand tie-in, right? Si spleen is the foot tie-in, remember? Yes. And the lung is the hand tie-in or hand greater yin. Very good. Okay. Paano naging affected si kidney? Meron na siyang impotence, inability to maintain an erection for more than 1 minute. Exhaustion, cold hands. Diba nasabi natin kanina, pag affected si spleen, affected din po si kidney. No? And take note, most people would only look at the asthma. They do not realize na, diba, ano ba function ng kidney with regards to the qi? Diba, ang flow ng qi ng lung is...
Nagsasend siya sa lung.
Oo, siya yung nag-anchor ng qi downward. Diba? Mahina Kaya, nag-asthma siya.
Na-asthma.
So, and the worst thing here is, the steroids are actually affecting the kidneys. No? So, sana po, galingan natin yung ating pag-aaral, damihan natin yung ating familia para marami tayong matulungan. I'm not saying that we compete with the allopathic Western doctors, but let's probably tell them that we can we can help their patients more if they try to learn something from us, no? Ganun lang po. Okay, so the correct answer is pale tongue body with a thin white coating. Thin white. What I was trying to say earlier is, ito kasing na letter D, it should have been yin deficiency. So ang tanong ko, anong pagkakaiba ng yin deficiency sa yang deficiency or qi deficiency? So pag yin
Ano
deficiency,
po?
remember pinapawisan yung pasyente rin. Okay, pinapawisan ka
Opo.
ba sa umaga, sa araw, pag meron kang yin deficiency? O sa gabi lang?
Sa gabi
Gabi
po.
lang. Night sweats, right?
Opo. Opo, night sweat.
And we have here a patient who sweats very easily during the day with the slightest exertion. Okay, so I hope that makes sense. Thank you po. Let's go to number 4.
Number 4. Steve, a 29-year-old man, present with excruciating epigastric and abdominal pain that is so severe that he cannot tolerate being touched. There is a strong sensation of coldness in epigastrium. He is vomiting and unable to eat. There are big lumps or knots in the abdominal skin that looks like worm. Which of the following tongue present would you expect to see in this patient? A. Red tongue body with a greasy yellow coating. B. Red tongue body with a thin white coating. C. Pale tongue body with a moist white tongue coating. D. Pale tongue body with teeth marks and no coating. So, yung answer ko po dito, Doc, is letter C po. Kasi wala naman pong, yung A and B, wala pong, may pareho po itong may hit eh. So, wala pong nabanggit na hit dun sa ano niya po, description.
So
Yung
tatanggalin na natin
C
yung A
po,
and B.
A
Wala
and
na
B
po
po,
si A
apa.
and B. Okay, good. So we are left with...
C and D naman po kasi. C and D po. So, ang answer ko po is C kasi po, moist white tongue coating kasi meron po siyang big lumps. So, ibig sabihin po, may phlegm po siya. So, si letter D kasi is teeth mark with no coating. So, si teeth mark kasi is deficiency eh.
Okay. So,
So, ang
okay.
best answer po is C.
Okay, ganito po. Ano po yung condition ng patient? Excess or deficient? Remember, ayaw niyang pahawak.
Opo.
Cannot tolerate being touched. Okay, Ma'am Annalyn, please prepare for number 6 to 10. Huh? 6 to 10. Okay. So, this is definitely excess. And what makes it excess? Kasi sabi mo nga, meron ng mga lumps or knots in the abdominal skin.
Yes po.
Look like worm. So this is probably maybe medyo nagkaroon na ng phlegm because of the too much cold, no? Yun nga lang, in pain siya, excruciating, no? Kasi pag deficiency ito, mas nawawala ang pain pag pinalpate mo ng malalim. Okay? Coldness in the epigastrium. Sensation of coldness. So there's just too much cold. And so I think the reason here should be kasi moist white tongue coating eh. So this is more descriptive of a cold condition rather than this one.
Yes.
Teeth marks said deficiency siya. Cold.
Yes po.
There's too much cold. White, moist, huh? Basta moist white tongue coating and pale.
Yes po.
Yeah, very good. And the last one, Ma'am Angel.
Number 5. Marian is a 50-year-old woman, has been suffering from headaches for the past 3 years. The headaches occur mostly in the forehead and facial areas, but also on the top of the head. The headaches started after a fast and are worse during the daytime. They are accompanied by a feeling of fuzziness in the head. She reported that she also been suffering from chronic cataract, and rhinitis for the past 25 years. She suffers with chronic low back pain and frequent urination. She feels tired. She is also constipated and does not move her bowel every day. When she does have a bowel movement, the stools are loose. She generally feels cold with which of the following tongue and pulse sign with this patient most likely. So A is deep and pale pulse, pale and stiff tongue with a thin white coating. B, deep and pale pulse, pale and swollen tongue with a sticky white coating. C, deep and pale pulse, pale and swollen tongue with a sticky yellow coating. D, thin and wiry pulse, pale and stiff tongue with sticky yellow coating. Si cataract po kasi, chronic cataract, build up of mucus po siya in airway. So,
Okay.
opo. So, ibig sabihin, meron siyang dampness agad kasi may mucus po eh.
Sticky
So,
white. Okay.
yes po. So, ang answer ko po is letter B po, yung sticky white coating. Deep and pale pulse, pale and swollen tongue with the sticky white coating. Yung C po kasi, yellow coating po siya. So, wala naman pong
Walang
nabanggit na heat. Opo.
Okay.
So, ganun din si letter D. Wala rin pong nabanggit na heat. Tapos si A naman po kasi is stiff tongue. So, hindi naman po siya stiff tongue. So, best answer ko po is letter D.
B as in boy.
Letter B po. Apo, boy po.
Okay. Okay. Ano ibig sabihin pag yung headache mostly nasa forehead? Diba meron din siyang sa vertex, no?
Frontal headache, Doc?
Oo, frontal headache. Bakit, ano po ang channel involved pag forehead? It's actually the stomach, okay? Stomach. So stomach is the part of the spleen. Yeah. And pag dito, so it's liver, no? You try to check that, baka mali ako, but I think I'm right. It's always like, if they complain of frontal, and remember, yung mga yung mga mayroong sinusitis, they also have that. Diba? Stomach, large intestine. Yes. So, same polarity, Yang Ming. Okay? She has also been suffering, dito nga, chronic catarrh and rhinitis for the past 25 years. So, yun. So, the lungs, because of the same polarity ng large intestine and stomach, Yang Ming. Chronic low back pain, frequent urination. Ano nangyari po dito? Bakit siya naging constipated, does not move her bowels every day, no? Chronic low back pain, frequent urination. Okay, so you can become constipated if you have too much phlegm. Did you know that? There was a time I had two patients. One was young male patients. One was 16 or 17 and the other one was 12. Yung isa, nakita ko from the tongue, talagang may heat. Yung isa naman, kapal ng tongue at saka moist. Yon. And then he would just, like the last time he moved was 3 weeks, 2 weeks or 3 weeks. So both cases are constipation, but I treated them differently. For only one session kasi nakadumi na right after. So this is where you can see the importance of really knowing how to diagnose the condition. Okay? Kasi most of us would think, ay, naku, bigyan natin ng fiber. Oh, these are the points for constipation. But remember, there are many causes of constipation. Okay? So this is what I was trying to inculcate in every student of LAM. Let's try to study hard. Kaya nga, we have 8 to 9 p.m. lectures every Monday, Tuesday, Wednesday for pulse and tongue. And I know it's long, but frequent or constant repetition will make you a very good practitioner. And believe me, you're going to win the hearts of your patient. Yun nga lang, mabilis silang gumaling. No? Ako, I'd rather... Kasi pag yung pasyente mo balik-balik na isang, like, naka 10 sessions na, ganun pa rin yung problem. So there must be something wrong with your diagnosis. Okay? So yon. I hope we are going to focus all our efforts in diagnostics. Okay, so maraming salamat, Ma'am Angel. Good job.
Thank you po, Doc.
Thank you. It's so obvious na inaral mo talaga. Okay, let's go to let's call on Ma'am, yes, Annalene. And then please prepare Ma'am, for 11 to 15, Ma'am Lynn, huh? You'll be the next that I would call, Ma'am Lynn Galarita, 11 to 15. So let's go to Ma'am Annalene. I'm sure nag-aral din to. And I'm so all proud of you. You're so good. You know, how I wish I had your brains when I was still studying for my CAA. And you know, Dr. Palanca would have been so proud of you. That this is the way we should do it. Okay, Ma'am Annalene, please.
Yes, number 6, Sarah, a 35-year-old female patient, suffers from insomnia during the past 3 years since she had her second baby. She took Lestor, the spleen decoction, for 2 months, but her insomnia symptoms did not improve at all. 2 weeks ago, she started taking sour jujube decoction, and her sleep has improved greatly. What kind of tongue and pulse presentation would you expect in this patient? Letter A, pale tongue with a thin white coating, thin and deficient pulse. Letter B, flabby tongue with teeth marks and a thin white coating, slippery and deficient pulse. Letter C, red tongue with little coating, thin and rapid pulse. Letter D, dry red tongue with little coating, thin, weary, and rapid pulse. So the answer is letter D, dry red tongue with little coating, thin, weary, and rapid pulse.
Okay, since we're not
Yes
studying
po.
herbs, no? So let's analyze first the patient. 35-year-old female, may insomnia siya for the past 3 years. Pagkatapos siyang pinanganak yung second baby niya. So you would immediately, okay, when you say, uminom siya ng restore the spleen decoction, so probably the herbalist or the acupuncturist was thinking of a spleen chi deficiency, no? Ganon. Hindi nag-improve. So ano kaya sa palagay mo ang nangyari? Imagine mo ha, nagkaroon kaya siya ng blood loss, severe blood loss during the delivery?
Possible po. So
Possible.
possible meron siyang liver chi deficiency or
liver,
stagnation,
yeah.
blood.
O baka ang dami niyang dugo na wala, di ba? And so, magkakaroon tayo ng suspicion that it was probably blood deficiency.
Blood
And
deficiency.
yeah, ang nangyari, mukhang hindi nag-resolve. Kasi binigyan siya ng restore the spleen thinking that it was a chi deficiency. Right? Pero ang ano siguro dito, when you say SAR decoction, what organ are we trying to restore here? Maasim. Maasim ang mukha.
Liver. No.
Yeah, liver, you were right. Liver.
Liver.
So, Are we safe to conclude that we have a case of liver blood deficiency na nagkaroon na ng liver
Yes
yin
po.
deficiency? Yes. Okay,
Yes
let's take a
po.
look.
Yes.
Or kung hindi natin alam ano itong decoction na to, it's just enough that when you give something sour, this is very good for the liver, right? So your answer is letter D, dry red tongue with little coating. Okay, ito pa lang, yung sinabi mong wiry, this is very liver.
Liver. Opo.
Thin means deficiency. Okay, rapid pulse, meron na pong heat. So, are we going to think that meron na po siyang empty heat?
Yes. Yes po. Kasi red tongue na with little coating.
Very good. Wow, ang galing. Okay. Let's move on to number 7. Mukhang hindi talaga kayo nagkakamali ah. Grabe, ang galing. Okay, let's go to number 7, Ma'am Annalyn.
Dog. A 35-year-old male patient was diagnosed with hepatitis C 2 years ago. He complains of epigastric focal distension, fullness and tightness, but without pain, and frequent dry heaves, periodic diarrhea, and anorexia. For 1 month, he has taken Pinilia decoction to drain the epigastrium and now reports that he feels his symptoms are much improved. What kind of tongue coating would you expect this patient to have prior to taking the formula? So letter A, thin, greasy yellow. Letter B, thick, moist, white. Letter C, thin, greasy. Then letter D, no tongue coating.
Okay.
The answer, yes po. The answer po is letter A, thin, greasy yellow. Yellow
Why?
coating. Kasi po,
May
so
hepatitis.
meron siya, yes, may hepatitis. Then, meron siyang epigastric focal distension and feeling niya yung fullness and tight.
Mm-hmm. Okay. When you have hepatitis C, we're talking about toxicity here, no?
Yes po.
Toxic heat. So eventually, doon tayo mag-iisip, alin ba dito ang may heat? So definitely, you will not consider letter B, thick, moist, white, di ba?
Opo.
Nor would you even consider thin and greasy. Probably, pwede. Or no tongue coating, because no tongue coating means there is yin deficiency. Do you agree?
Yes po.
Okay. So, ano kasi dito for 1 month, kung uminom siya ng decoction to drain the epigastrium. So, ano ang dinrain dito?
Yung acid.
Mm-hmm. Okay. Wait lang. Meron siyang
Opo.
fullness and
Yes
tightness,
po.
but without pain. Fullness, what does that make you think? Like fullness, parang ano ba? Epigastric focal distension, periodic diarrhea, anorexia. So actually, ganito po siguro nangyari. Remember, when you have hepatitis C, the liver is affected, right?
Yes
So when
po.
the liver is affected, ano ang impact niyan sa earth? Liver is wood, di ba? Anong
Opo.
impact niya sa earth?
Ihina po.
Mahina si spleen. Okay,
Yes
humina kaya si spleen. May periodic diarrhea, may anorexia, and there is fullness. Probably nagkaroon ng dampness na. Right?
Opo.
Kaya may dinidrain. So, if you think of dampness, you would be thinking of greasy, right?
Yes po.
Pero nagkaroon na siya ng heat.
That's
Yung
why
diarrhea.
yellow.
Kasi meron na siyang mga dry heaves, may lumalabas na ng mga ano. Okay? Very good. So the correct answer is A. Let's move on to number 8.
A 32-year-old male suffers from acute hepatitis. His TCM doctor suggests that he take minor glucorum decoction because, according to TCM diagnosis, this patient will likely have a Shaoyang pattern. What kind of tongue coating is this patient likely to have at this stage? Letter A, dry and yellow. Letter B, white and moist. Letter C, thick and white. And letter D, thin and white. So, kapag po yung may problema yung Shaoyang, yung lesser yin, so it can be letter D po. The answer is thin and white. So,
hindi affected yung coating
opo.
because thin and white is normal, right?
Yes po.
Okay. So acute hepatitis. Wow. Okay. Bakit hindi dry and yellow? Kasi ano ba? Anong pattern na ba pag yellow?
Walang sign. Walang sign ng heat.
Okay. In fact, when you look at Shaoyang, that's lesser yang.
Lesser.
Okay, makes sense?
Lesser, yeah.
Okay.
Yes.
Mas yin na yin. Hindi siya masyadong mainit. Unlike thick and white and moist, you'd think of cold. Okay, very good. Number 9.
Number 9, a 58-year-old male has suffered from chronic bronchitis for over 10 years. 5 days ago, his cough worsened when he coughed a cold. Now, he coughs all day with profuse thick yellow sputum that is difficult to expectorate. He reports fullness and distension in the chest and hypochondriac region as well as chest pain induced by cough. Other symptoms include shortness of breath and sonorous breathing, a red face, thirst with a desire to drink water, so and a slippery rapid pulse. Which of the following tongue description would you most likely find in this patient? Letter A, red tongue with thin yellow coating. Letter B, red tongue with a thin greasy yellow coating. Letter D, red tongue without coating. And letter D, red tongue with a thick, turbid, greasy coating. So the answer po is letter B, red tongue with a thin, greasy yellow coating. Kasi yung face niya, nag-manifest siya ng red face, so it means merong heat. Thirst with a desire drink water. So siya, mataas yung heat niya. So yang, more on yang.
Bakit?
Then,
okay. Si letter D, bakit hindi mo pinili si D? Red tongue with thick, turbid, greasy coating.
Wala namang manifestation ng dampness.
Wow. Okay. Okay, great. So this is a patient in which meron na po siyang deficiency. Remember, chronic bronchitis for over 10 years. And so madali lang siyang kapitan ng ng cold, no? So profuse thick yellow sputum kaagad na mahirap i-expectorate. So yon, fullness and distension in the chest. It's because of the and hypochondriac region, chest pain induced by cough. Okay. Red face. Kaya puro red tongue, no? So bakit okay. There's a lot of dampness. Okay, very good. Wala pang sensation of heaviness, no? Okay, let's go to number 10.
Number 10, a 55-year-old male has suffered from hemiplegia or post-stroke sequelae on his left side for the past 5 months. It is difficult for him to speak clearly, and he also has a deviated mouth and eyes. His face looks withered, yellow without sheen. His lips are slightly swollen. His face is thin, choppy, and porceless. With which of the following tongue appearances might he present? Letter A, red tongue with a greasy yellow coating. Letter B, pale tongue with a thin white coating. Letter C, red tongue with a yellow coating. And letter D, pale tongue with a white greasy coating. So the answer po is letter B, pale tongue with a thin white coating. So, kasi po, so nag-suffer siya ng post-stroke. Sinabi dito, manifestation niya, meron siyang deviated mouth and eyes. Then, yung wala ng shen. So, wala ng shen yung kanyang yung kanyang mukha. Then, ang pulse niya po ay thin and forceless. So, probably, so ang makikita sa tongue niya, pale and thin white coating.
So bakit hindi mo sinagot
Kulang
yung
na sa dugo.
Definitely hindi
Yung,
siya red tongue, di ba?
opo, kasi wala mang manifestation ng ng
So
yang.
we are left with B and D, di ba? So ang tanong, bakit
Opo.
hindi mo pinili yung pale tongue with a white greasy coating?
Kasi hindi naman pinakita na merong dampness.
Okay, very good. Thank you, Ma'am Annalyn. Good job. Excellent.
Sige po.
Okay, let's call on Ma'am Lynn Galarita for 11 to 15. Okay, Sir AK, please prepare for 16 to 20. 16 to 20 po kayo, Sir AK. Ma'am Lynn, I'm sure. I thank you pala for bringing to my attention na yung number 25 kasi po naka-PDF format, hindi masyadong nakita yung question, right? So I hope that has been resolved now. Thank you for bringing it to my attention. Maraming salamat po. So Ma'am Lynn, are we okay?
Yes po. Good evening.
Good evening po.
Good evening po.
Makita ka naman
Okay,
ng
number 11.
para makita sa ating mga viewers from other countries. Yan. Ay, bakit
Wait
saglit
lang.
lang?
Ayan na po.
Yan, okay.
Ayan na siya.
Kita yung mukha mo. Itaas mo pa ng konti yung ano. But they would know how good the students of LAMP are. Bakit nabaligtad? Oh, yan. Very good. How are you doing, Ma'am Lynn? Are you feeling better?
Medyo po. Nag-take na po ako nung sinuggest yung coconut oil.
Did it work?
Po, yung sinuggest ni AK na klase ng DCO ang aking iniinom. Yung ano to?
Wow. At saka mas malinaw yung pag-iisip, no? Nasagot mo lahat. Okay. Okay. Let's go to number 11 to 15.
Okay, number 11. Lily is a 35-year-old female who was diagnosed with uterine fibromyoma. Over the past 5 years, she has experienced profuse menstrual bleeding and severe cramping. The menses is dark red with spots. The abdominal cramps are worse with pressure but relieved by warmth. Which of the following signs might she also have? B. Dry lips. B. Red tongue tip. Letter C. Scanty coating. Letter D. Purplish spots on the tongue border. Tingin ko this is a case of blood stagnation due to food.
Okay.
Yung fibromyomas, benign tumors in the uterus po eh. Tapos, yung cramps na nare-relieve with warmth indicates na mayroong food. So, kaya yung answer ko po letter D. Yung blood stagnation siya. So, first spot in the border.
Okay, very good. Alam niyo ba, this is very concerning, no? So, as long as may symptoms yung babae, the tongue may not exactly look purple yet, but you have to also look under the tongue for the sublingual vein. So you would notice na talagang siya, dilated and para siyang mga earthworms, and it's so congested and dark colored, no? However, pag may nakita kang purplish spots sa tongue border, tatlo lang ibig sabihin niyan. Could be the heart, the lungs, or the uterus in women. Okay, sa border ng tongue. So again, you have to really look for you have to really confirm kung may mga symptoms ba talaga. Okay? So yun. Okay, your answer is purplish spots on the tongue border. So your ability to be able to see the purplish spots is very, very critical. No? So, alam naman natin ang uterine fibromyomas or yung myoma na tinatawag is really phlegm siya na nag-stagnate na, matigas na siya. So, dapat maaga pa lang, tingnan na natin yung underside ng tongue natin to find out if meron ka bang issue with blood stasis. Okay? So, thank you. The correct answer is letter D. Let's go to number 12.
Number 12. Mary is the 68-year-old female who was diagnosed with emphysema 5 years ago with severe aggravated during the winter. She complains of shortness of breath, wheezing, coughing with copious flatulence symptoms, and a heavy, tight feeling in the chest. She also complains of weakness in the legs and low back. Which of the following signs might she also have at this time? Letter A, red tongue with yellow coating, rapid and slippery pulse. Letter B, greasy white coating, frail and slippery pulse. Letter C, pale tongue with a moist white coating, submerged and slow pulse. Letter D, purple tongue with a thin coating, choppy and wiry pulse. Tingin ko po, this is a case of lung deficiency kasi matagal na yung chronic na yung kanyang emphysema. So I choose letter C, pale tongue with a moist white coating, submerged and slow pulse.
Okay. Una-una po titingnan ninyo yung age. Tingnan niyo po yung age niya, 68 na. No? Just because meron siyang emphysema, iisipin natin kaagad lang yung issue. Okay? 68 years old. So what are we talking about here? Obviously, mahina na yung kidney yin niya or essence. Di ba? Nakikita niyo po ito, complaining of weakness in the legs and low back. Low back. That's very kidney, right? Yes. Hello. Kidney yan. And we would like to always connect the kidney with the lungs. Right? Kaya yung iba dyan, na biglang naging asthmatic, nung medyo tumanda na, you have to know what to do. So, make sure that you have very good kidneys. Whether you like it or not, talagang hihina yung kidneys, lalo na pag masyado tayong hardworking. So she was diagnosed with emphysema 5 years ago and nag-aggravating symptoms during the winter. So definitely meron din siyang lung. Okay. Are you sure it's lung qi deficiency only or is it something else? Take note, wheezing, coughing with copious watery sputum. Anyway, shortness of breath is definitely lung qi deficiency, right? Wheezing, coughing with copious watery sputum. Is this very yin or is it very yang? Heavy, tight feeling in the chest. So meron na pong phlegm. Okay? So bakit hindi niyo sinagot ang letter A? Ano po?
Yellow coating po kasi.
Okay, so wala tayong nakikitang heat. Very good. Saka rapid pulse. Damp heat. Okay. Ang pulse niya kasi, wala pala tayo pala maghanap ng pulse. Bakit mali ang letter B? Greasy white coating.
Slippery pulse.
Okay.
Greasy white coating with the dampness.
Okay. Do we have, bakit mali si purple tongue with a thin coating? Do you see any blood stasis with the individual? Okay, wala. So the best answer is pale tongue, which speaks a lot about lung qi deficiency, right? Pero moist white coating, this is probably a combination. You know why? Meron din siyang kidney yang deficiency. Do you agree? Low back. Copious watery sputum. And submerged pulse, slow pulse. Ito ang slow pulse. Slow signifies heat or cold. Okay. So there. Let's go to number 13, Ma'am Lynn.
Number 13, a 6-year-old male patient complains of a dry and sore throat with hoarseness for over 2 months. Last week, he also found a small hardening in the throat area, and his hoarseness is still getting worse. He has a dry purple tongue and a choppy cough. What is the pathogenesis that is causing his letter A? Phlegm obstructing the throat. Letter B, exterior dryness attack. Letter C, blood stagnation. Letter D, lung and kidney deficiency. Yung hard nose, purple tongue, choppy pulse all indicates blood stagnation.
Okay, napaka-obvious, no? Ito yung sinasabi ko. Pag medyo mahaba-haba ang question, unahin niyo po yung tongue and pulse pag binigay. Kita nyo, dry purple tongue, choppy pulse. Choppy, purple, very blood stagnation. Okay? So, hoarseness. Okay, correct answer is letter C. Number 14, Ma'am Lynn.
Number 14. Linda told you that my 76-year-old father is always murmuring to himself with repetitions and interruptions. The content is inherent that it stops reading voice. Consciousness is here, but its thinking and reaction are slow. What is the pathogen? Letter A, heart chi and or blood deficiency. Letter D, heat disturbing the heart. Letter C, kidney deficiency. Letter D, blood stagnation. Yung slow reaction indicates deficiency, murmuring to himself, and state of Shen has something to do with the heart. Pero, ay, isa lang po ito, letter A po, heart chi and blood deficiency. Kasi hindi naman po siya heat. Hindi siya yung listing the heart kasi yung consciousness niya clear pa naman. Wala siyang manic.
Coherent. Consciousness is clear. Okay, ang ano kasi dito po, yung pinaka-leading, ito po, thinking and reactions are slow, mabagal. So that's very chi deficiency. Okay? Okay. Kidney deficiency, hindi rin kasi wala tayong night sweats, no? Diba? Okay. Correct answer is letter A.
Number 15. A 56-year-old male patient was diagnosed with asthma over the past 15 years. Symptoms and signs include shallow and difficult breathing or shortness of breath. Inhalation were difficult than exhalation, and symptoms worsen with exertion. Which of the following patterns apply to him? Letter A, lung chi deficiency. Letter B, enzyme accumulation in the lungs. Letter C, kidney deficiency. Letter D, yin yang deficiency. Letter A po, lung qi deficiency. Kasi ang alam ko, lung control inhalation, ang kidney control exhalation. So kung mas difficult yung pag-inhale, so it has something to do with the lungs.
So your answer is?
A.
Actually, ang pinaka-ano dito, okay, when you're having difficulty inhaling, what does it mean? When you inhale, are you actually will you not have a problem if mahina ang kidney mo? Diba the kidney is supposed to anchor the lung qi? Pero pag mahina ang kidney mo, hindi niya ma-anchor, so mangyayari, mas mag-exhale ka. Okay? Now, when you have lung qi deficiency, you don't necessarily have that kind of problem. It's just that ang clue kasi dito pag lung qi deficiency, ano yan with everything is with an effort. No? Kahit konting madali lang mapagod. Yun yung lung qi deficiency. And almost always you will only have shortness of breath. Okay, there's also, but ang keyword kasi dito po is inhalation. And take note that the patient is already 56 years old, diagnosed with asthma over the past 15 years. Super tagal na. Okay? So hindi na natin iniisip lang lung qi deficiency lang. Okay? We are looking at the very chronic problem. And of course, ang problem talaga niya is the kidney. Do you agree? Okay, if you remember, the kidney is supposed to anchor the qi. Yun. So when you have this kind of like inhalation is more difficult than exhalation. So if you see a patient with asthma, first you have to consider the age, and then you have to identify kung mas mahirap ba siya mag-inhale kaysa sa mag-exhale. Okay? So pag nag-i-inhale ka and you are able to do it, try nyo daw i-hold, mag-inhale. Yung iba hindi makatagal mag-inhale. You try to hold your breath. Do you know diaphragmatic breathing? You inhale through the nose, let it stay, like hold for a few seconds, and then exhale very, very slowly. Kung mabilis siya mag-exhale kaysa sa mag-inhale, then there is a very big problem. Okay? So lung qi deficiency is not a very strong answer. Kidney deficiency po siya. Any comments? But anyway, you did a good job.
Kaya kasi, Doc, kidney ang responsible for exhalation. So, ang nakita ko kasi po, mas
Can I ask?
Medyo matagal na kasi yung asthma niya. Over the past 15 years. Okay? Yan ang titingnan niyo mabuti.
Doc, can I ask some questions regarding this case?
Yes, please.
As number 15, 56 years old, so do we consider din na rin yung spleen problem, spleen? Hindi na siya support sa kidney at saka lungs?
Yes, definitely, yeah. Kasi alam mo, nakasalalay sa kidney ang spleen.
Yeah. Opo.
Lalo na pag meron kang kidney yang deficiency,
yes.
Hindi lang ang spleen affected And remember, we need the spleen to actually transform and transform.
Yes.
And we need the spleen to have a very good qi for it to be able to produce blood. Diba? So affected yung mga organs. Kaya if you notice, pag nagda-dialysis ang mga tao, ang daming problema, no? Kaya ito yung ayaw nating mangyari pagtanda natin.
Opo.
Nagkaka-asthma. Okay? So, when you say matanda, sa lalaki, at the age of 40, your vitality is already starting to weaken. That's really the law.
Opo.
And things will be no longer the same. No? So we want you to attend the lecture on Monday or Tuesday for the basics. Okay? This is where we discuss. Yung ano kasi, yung babae every 7 years. Kaya mas madaling magmukhang matanda ang babae kaysa lalaki. Okay, so ang lalaki naman every 8 years. 8, tapos 16, di ba 16 pwede nang magbuntis yung lalaki magbuntis. And when you reach 40 and above, then that's where nandoon na yung peak eh. So you have to start. That's why some people, they look older than their age. Yon. And yung iba nagtataka, hindi naman asthmatic nung medyo matanda. Pero bakit ngayon? Parang inuubo na parati. O hinihika. Diba? Sabi nga nila, if you're asthmatic, pambata lang yan na problem. But it's a different story when you have very weak kidney. And it's unavoidable because ang dami nating problema, masyado tayong inabuso natin yung katawan natin, or masyado tayong maraming sexual activity, yung mga ganon. And we make use of our brains all the time because of our dreams, our goals. And also, when you meet accidents, when you get sick, kaya as much as possible, you should not get sick. And also, hindi naman mapiprevent eh. When you start taking care of someone, especially meron kayong mahal sa buhay na pasyente, let's say umabot ng 5 taon, 10 taon, magmumukha kang matanda bigla. Na-absorb mo lahat ng negative energy. Okay? Does that answer your question? So eventually the spleen gets affected.
Yes po. Thank you for the information po.
Thank you. Okay, good job, Ma'am Ling. So we just need to correct you with letter C. Okay? Sige. Lung Qi deficiency is actually the start. Hindi pa siya ganun katagal. Diba? Parang humina lang yung function ng lungs. Okay. Okay. And also, yung kamay mo, lumamig, madaling magpawis, yung mga ganon. Because the lung qi actually controls your wei qi. And pag mahina yung lung qi mo, hindi nagsasara yung mga skin pores mo, kaya mabasa. And then also, you may have a weak voice. Because, sige, mamaya na lang. Mukhang umaba na. Thank you very much. Now let's go to Sir AK. I'd like Sir Michael to prepare for number 21 to 25. Sir Michael, it's your turn. Okay, 21 to 25. Okay, let's go, Sir AK. Uy, puro to mga prescriptions.
Doc, puro acupuncture points na naman to.
You just give the correct answer po.
Okay, Doc. Number 16, the best prescription for treatment of jaundice of the young type is the answer, Doc, is the best is letter B with the bladder 19, gallbladder 34, spleen 9, stomach 44, liver 3, bladder 18. Tata is anak class. Sa akin, Doc, ang option ko dito is B and E.
B and E?
Oh, Doc, pero yung answer ko po is letter B.
Boy.
Opo, boy.
Okay, pag-usapan natin to. Pag sinabi mo ba ang jaundice yang type, are we talking about the gallbladder being affected more? Or is it the liver? Gallbladder is more young, right?
Yes, Doc.
Okay. So sinabi mo you were like, you wanted to choose between B and E. So pag titingnan natin si E, may bladder 18 siya. And bladder
Yes,
18
Doc.
we know is the back shoe of the liver, right?
Yes, Doc.
Meron din siyang bladder 19. That's the back
And
shoe
meron
of
din
the
po siyang
gallbladder.
spleen 9, dampness
Okay.
or dampness.
Anong meron? So bakit B ang sagot mo?
I think, Doc, dahil ang concern niya is liver, that's why merong liver 3 and bladder 18. Then,
May
yung,
Bakit walang liver 3 sa letter E?
yun, Doc, kaya hindi ko siya pinili. Kasi
Actually, it's the gallbladder 34 that is very relevant here. Di ba, gallbladder 34? It is the one that, ano nga tawag dito sa
Foci point.
GB34? Yeah.
Foci point and to move liver 3, Doc, tama ba?
Anong classification ni GB34? Para this can confirm.
Foci and at the same time, Doc, meeting point
Ng?
sinus.
Yeah. So when you talk about young, you're talking about the sinews. Who's a point of the gallbladder? And kasi ganito ano ba paano ba to? Kasi sobra yung yang. Mainit. Jaundice yang type. No? So syempre, hahanap ka ng dagat. Do we see any Hussey point or C point sa letter E?
Wala, Doc.
What about spleen 9?
Foci point. Foci point.
Di ba Hussey point yan yung spleen 9?
Yes, Doc. Foci point ng ano siya.
So bakit between gallbladder 34 and spleen 9 for jaundice young type, gallbladder 34 is a better choice? Una, how do you classify a spleen channel? Is it a yin channel or is it a yang channel?
A yin channel, Doc.
Okay, so that explains it. So the correct answer is letter B. Okay? Bakit stomach 44?
Clear heat, Doc.
Yeah. Liver 3.
Yung spring yan, Doc, eh.
Okay,
Yung
very good.
stomach 44.
Okay, remember, all the points, except for bladder 19 and bladder 18, are located from the, ano ba to? From the knee down. Diba from the knee down, you're talking
Below
about,
the knee.
yeah, below the knee. Ito na yung mga energy points na tinatawag. Ay, yung tinatawag nating shoe points, right? Okay, unlike letter E, iisa lang yung ano niya, iisa lang yung spleen 9 lang. Banda spleen 9, between spleen 9 and GB34, we would opt to use GB34 because the jaundice is of the young type. Gets nyo ba po ito? Okay lang? Okay. Number 17. Sir AK.
Okay, number 17. In addition to the main points such as spleen 9, stomach 36, ba't yun siya? D18, D19, which of the following points should you select in treatment of jaundice? Again, jaundice again. The answer,
Johnson
Doc,
in
is
general.
uh, do 9, Doc. Letter E.
Bakit ayaw mong gamitin si do 4?
Do 9. Between do 9 and do 4. Si do 9 kasi, Doc, usually ano siya eh, pareho ba siyang may to treat damp heat at the same time jaundice? Damp heat in the liver and the gallbladder kasi, Doc, ang do 9 eh, di ba? So jaundice is affected niya is liver and gallbladder.
Actually, do 9 is so good for for the middle jaw and the spleen actually. And damp heat, no? And alam naman natin ng jaundice, no? So magaling siya for jaundice, do 9. Ang tanong ko, do 4, do you think it would help? Like, ano ba, sa do 4 kasi, we're actually regulating the heat of the the yang of the whole body, right? It's the Mingmen fire.
Yes, Doc. More on do 4 ang alam ko, Doc, is ano to eh, tonification, Doc eh, ng yin yang eh. Tama ba ng kidney at the same time? Mingmen eh.
It tonifies kidney qi, kidney yang, tonifies din yung original qi mo, and napaka-importante niya to nourish your essence. So kung gusto mong dumami yung similya mo, so yan, do 4. As long as hindi ka pa ganun katanda. And it can also clear heat, and it strengthens your lumbar spine. But yun. So it's more of the essence, not about the jaundice, no? So what about REN
Yes, Doc.
6? Why did you not choose REN 6? Ano bang classification ni REN 6?
Ano si REN 6?
Ano lang naman din siya, katulad, ini-strengthen din niya yung...
Halos pareho ni do 4, Doc. Ay,
Ni
tama
do
ba?
4,
Tama pa.
yeah.
Opo, parang si do 4 din siya eh.
Yes. Oo, ganun din. Di ba? Original chi, kidney chi and yang, and also maganda din siya for hindi siya for the jaundice. Okay, what about, so do 14, alam naman natin is to what?
Front mo of the heart, Doc.
Do 14?
Do 14.
Mukhang hindi yata.
Do 14.
Do 14, dito nagko-cross yung yung tatlong yang meridians of the hand and the 3 yang meridians of the foot. So I don't think this is very good for jaundice. Bladder 20 pa siguro. Pero do you think may relevance siya? Like, would you be able to, would you opt to use bladder 20, which is the back shoe of the spleen? Or mukhang walang sense?
Parang malayo siya, Doc. Mas maraming options na maganda.
Okay.
Maliban sa bladder 20. Kung jaundice ang pag-uusapan.
So the best would be do 9.
Do 9, Doc.
Okay, very good. Let's go to number 18.
Okay. Number 18, apart from the main points such as bladder 25, stomach 25, Sanjiao 6, which of the following points would you use to treat constipation? Constipation, bladder 20, bladder 21, kidney 3, and 12. The answer, Doc, is letter A, kidney 6. Kasi usually, Doc, ang kidney 6 is used for kidney yin deficiency, and constipation is yin deficient. Kasi itong bladder 25 is the backshoe of the large intestine, and
Mhm.
the stomach 25 naman is the front mu.
So bakit kidney
And
6
san,
ang maganda? Like, what about
ano Doc eh,
Sanjiao 6? Anong kinalaman ni?
uh, ano rin siya Doc eh, ginagamit din siya sa sa constipation, Jing River to Doc eh,
Ay, wow, ang galing
of the
naman.
Sanjiao.
Grabe. Okay.
So, kumbaga Doc, parang dito sa mga nakalagay dito,
Uh-huh.
the best na isama natin is yung kidney 6. Kasi mas malayo yung ano eh, pwede rin po yung REN 12, pero meron na po kasing ano eh, bladder 25 and stomach 25.
Uh-huh.
Yung kidney 3 naman po, between kidney 3 and kidney 6, mas okay po yung kidney 6. Kasi
Okay. Okay, ganito. Actually, ganito gusto ko malaman. Una-una, you have to understand bakit yung mga points ang pinili. No? Like sinabi mo kanina, yung bladder 25 is the back shoe of the large intestine, right? And
yes,
stomach
Doc.
25 is the front mu of the large intestine. While sabi
Yes,
mo, Sanjiao 6, sa pagkakaalam ko, maganda siya for eliminating the heat. And it's very good for constipation, actually. So, your answer is kidney 6. So,
Yes, Doc.
are
Okay.
we safe to say that the reason why you use kidney 6, siyempre dapat mag-match doon sa pinili mong points eh. Meron definitely meron tayong heat na pinag-uusapan dito. Heat sa,
Yes, Doc.
you know. So, kasi si Sanjiao 6, ang pagkakaalam ko, tinatanggal talaga yung damp heat. 'Di ba? So, amongst the, like, parang overkill naman kung gagamitan natin ng bladder 20. So, we'll be looking at, kasi sabi mo Jing River ang ano, Jing River yung Sanjiao 6. Yun ba yun?
Yes, Doc.
Kasi pag
Opo.
Jing River, ibig sabihin, masyadong mainit. So pag masyadong mainit, are we talking about empty heat or full heat?
Dito Doc sa case na to,
Hmm.
full heat to Doc.
Are you sure? Eh bakit pinili mo si kidney 6? Kidney 6 is very good for yin.
Ay, yes Doc, yes Doc.
O, diba?
Tama, mali pala,
Nahuli
mali.
kita dyan.
Sorry.
Huwag ka ma-stress. Ganyan nag-revalida sa lab.
Medyo nakakalito yung Doc. Ano nga yan?
Kaya mo yan. Okay, kaya dito na mo bladder 25, stomach 25, puro LI. So ang tanong ko, paano siya naging related sa kidney?
Ano Doc ang tanong?
Puro
Bladder,
LI to back shoe of the large intestine, si bladder 25, sabi mo. Stomach 25 naman is the front mu of the large intestine. So, we already agreed that this is probably due to heat because Sanjiao 6 is very good for eliminating heat, being a Jing River of the Sanjiao channel, right? So, we're talking about, ang tanong ko naman is, kasi pinili mo kidney 6. So, the reason mo is because there is yin deficiency. So,
yes Doc.
ano kaya itsura ng pasyente dito? Like, ng tongue niya. Diyan na naman tayo sa tongue.
Yin deficiency, no coating Doc.
Very good. Actually, may heat na siya. Red na rin yung tongue. No?
Red yung tongue Doc, kasi
Kaya,
no coating.
kaya gumamit ng Sanjiao 6. Okay? Sanjiao 6 is the C point of the Sanjiao channel. So, syempre, kung naghahanap ka na ng dagat, mainit na talaga. Okay, so medyo pinaikot-ikot lang natin, but I think this is the most sensible way to treat a patient, to know why we use those points. Okay, let's go to number 19. Good job
Okay,
so
Doc.
far.
Which of the following prescription is the best choice to treat patient with the following sign and symptoms? Infrequent and difficult defecation every 3 to 5 days, sometime longer. Fullness and standing pain in the abdomen and hypochondriac regions. Frequent belching, loss of appetite, a thin, sticky tongue coating, and a string thought pulse.
Okay. Yeah. Okay, go. Your answer.
Ito Doc, yung letter B. Kasi bladder 25 again, stomach 25, Sanjiao 6. But this time is may REN 12 and liver 3.
Okay. Bakit mo ginamit ang REN 12? Para saan?
Sa stomach, Doc.
Frequent belching?
Yes, Doc, pwede.
Or full?
Fullness.
Okay. Bakit liver 3? Para saan?
Pwede siya, Doc, sa distending pain in the abdomen.
Yeah. To facilitate the chi flow, right?
Yes,
Good.
Doc.
At saka ano pa? Sa tongue and pulse, ano nakikita mo?
Sticky tongue coating and...
Take note, string taut pulse. String. Wiry. Di ba liver na liver? String taut. Parang gitara, no? Okay. Ano sa palagay mo ang naging scenario ng pasyente dito? Are we seeing a patient who's so galit, who's so stressed?
Yes, Doc. Baka nagkaroon siya ng Doc, ng liver chi stagnation muna eh.
Yes, talagang nagkaroon siya. Bakit? Fullness and distending pain in the abdomen. The key word is distending pain. That's chi stagnation. Okay? Frequent belching. Bakit? Because of the liver chi stagnation, humina sino?
Stomach.
The stomach. And
yes, Doc, naapektuhan siya.
Kaya ginamitan ng REN 12. Ang REN 12 kasi, front mu of the
stomach.
But it's very good for the spleen and the stomach to harmonize the spleen, the stomach. Okay. What else? Bakit sticky tongue coating? Thin sticky tongue coating.
Sticky.
Is it damp?
May na siya, Doc. Opo, Doc, may dampness na siya eh.
Okay. Kaya nga gumamit ng REN 12. Sige na, pwede na. Punta na tayo sa number 20. Ang galing nyo. Okay, go. Number 20.
Okay, number 20 is, apart from the main point such as bladder 25, stomach 25, employed in dealing with constipation caused by accumulation of cold, which of the following points would you use as secondary points?
Yes.
This time, Doc, ang problem is
cold.
Cold.
So,
and
pag cold, anong una-una mong iisipin? Like, ano yung pinaka-favorite natin pag may cold?
Pag cold, Doc, di ba, ang kailangan dyan is
we're going to do moxa?
Yes, Doc. I-expel yung yung cold eh. So usually ang sikat diyan, Doc, is itong itong REN 8 eh. This is the key. Yung REN 8 usually ginagamitan siya ng moxa eh. usually ginagamit siya to rescue yung collapse sa body natin. Tapos ginagamit din siya for to expel the accumulation ng cold sa body natin.
Okay. And REN 6?
Ang REN 6, Doc, parang kanina involved siya sa pagpapalakas, Doc, ng ng kidney yin and yang. So basically pag-tonify din ito yung sa REN 6.
So, will it be correct if you use kidney 6 and kidney 3?
Medyo Doc
Ano
kanina kasi 'di ba yung pinag-uusapan natin kanina.
yin na, 'di ba? Yin na,
Opo.
excess yin. Okay, bakit hindi mo ginamit si liver 3 and Sanjiao 6?
Liver.
Meron ba tayong, ano ba dapat hanapin mo dito para gamitin mo si liver 3? We're talking about
Chi. Issue ng liver chi is usually issue ng liver chi stagnation, to move chi. So dito, Doc, ang mas problema dito is yung accumulation of cold
Okay. So, ibig sabihin, itong si liver 3 and Sanjiao 6, gagamitin mo to for constipation due to
kung
liver
meron siya,
chi
Doc,
stagnation.
liver chi stagnation ang
Very good.
main
And
problem
ito naman
niyan.
si kidney 6 and kidney 3, you will use this for constipation due to
Kidney yin deficient, Doc.
very good. And LI11 and LI4, you will use that for constipation due to
Naman to, Doc, heat.
Galing.
Accumulation of heat. Kasi LI11 and LI4 very powerful to clear heat and to move blood.
Wala na ako masabi. And stomach 36 and spleen 6 for constipation
stomach,
due to
stomach, Doc.
dami na nating patterns, di ba? Dami na nating patterns. So ngayon, actually we have just discussed. Actually, I notice your questions are all about constipation. So we expect you to give a lecture on constipation using all the different patterns. Are you happy, Sir AK?
Yes, Doc. Constipation tsaka jaundice.
Yun nga lang, I have bad news for you. Pag ginalingan mo, let's say nakuha mo yung cause, nako, hindi na babalik yung pasyente kasi hindi na siya constipated. So you should always make friends with them. Sabihin mo, nako, kailangan bumalik kayo, kumpletuhin mo yung one course.
Laging problema yan, Doc, natin, di ba, gumagaling yung
income.
pasyente.
Oo nga So, well, I don't know. Pero ang akin lang kasi, unfair naman kung ano. So, nasa iyo na yon. Siguro ang gagawin natin ganito. Let us teach them tongue diagnosis. As long as hindi maganda yung tongue niya, no? There is always the possibility na magkakaroon ulit. So, parang alibay na natin yon for them to continue. Kahit once a week or twice a week for 10 sessions, di ba?
So, usually, Doc, once a month or twice a month for parang maintenance nila, gano'n na lang.
And then if you're really that good, expect referrals talaga. No, wag tayong magmukhang pera. Wag yung katulad nung isa, I had a patient, galing siya sa isang nagpa-practice din. Sabi niya, why is it na 25 sessions na siya doon sa kabila? Nandun pa din yung low back pain niya. So, hindi na lang ako umimik. So, yun. Naging friends na kami kasi I think 2 sessions or even. Una-una kasi, you should always, I would like to congratulate everyone who attended the auriculotherapy by Sir Albert. And I hope, nag-enjoy ba kayo doon? Ay, yung mga nag-attend. Okay, anyway, yung iba, marunong na. Diba? Katulad kahapon, I had one, classmates kami in medicine. She was OBGYN. And of course, we're of the same age. Actually, she wanted to see me, but she said, kasi nag-ultrasound siya, she has an ultrasound clinic. So, parating na isang posture, sakit dito. Siyempre, hindi mo muna sisingilin kasi friends kayo classmates kayo sa medicine. So, ginamitan ko ng ear. I just used, I think, 3 or 4 points. And she was surprised. Within like 2 minutes, 3 minutes, nawala yung pain niya rito. Isn't that great? So, syempre, hindi ko na palalagpasin. Sabi ko, medyo may nakikita akong linya sa mukha mo. So, I think it's about time that, we should not look our age. Diba? So, yun, I hope she will come back for the Aculift. Ganun po yan, no?
Tsaka Doc, dagdag ko lang, isa sa nakatulong din, I think dun sa practice ng lamp is yung marami siyang modalities. Like yung sinasabi nyo, yung sa ear acupuncture, may nagagamit siya Doc kasi di ba may mga case na minsan yung ginawa mo, limawa sa 5 pasyente mo na same case, like lower back pain, parang gumana tong mga points na to in acupuncture, pero magtataka ka kasi may case na hindi gumagana dun sa isa. That's why dito natin nagagamit yung ibang modalities or form, like yung ear or yung balancing, kahit na kumbaga hindi pa natin ganun ka-master, pero it helps dun sa patient.
In fact, I would like us to alam mo naman ako, I never stop. Scalp acupuncture works faster than ear. Would you like to learn it? All the 10 modalities. Syempre, isa-isa mo na modality. Maganda yung response ko doon. In fact, doon mo makikita gaano ka-useful po yung yung EA. So, yun. Let's talk about it. I hope you're watching the Acupuncture Matters. It's actually the most watched videos. Okay, I love doing it. Although I haven't, ewan ko lang, parang, sige, let's do it. Let's make it a trademark ng love. Let's not make things so difficult, diba? Let's not, huwag na tayong magyabang na dapat mahal ang babayaran, yung mga ganon. What is important is we make a lot of people happy. Okay? So, yun. Are you excited? I'm planning to do scalp acupuncture for stroke and pain relief. Only the scalp. Yeah.
Wow.
And ewan ko lang, I'm so inspired, especially if I have students like you who are so good. No? Itong gusto kong mangyari I want all of you to really think, ano nyo ba? Pagalingin nyo yung analytical thinking. Okay? So let's help each other. And I hope you will be all future trainers for LUM. No? Yes. Okay, so good job, Sir AK. Masyadong seryoso talaga. Puro constipation yung topic mo, no?
Thank you, Doc. Saka Jaundice po.
Siguro, tawagan natin yung for the next. Mukhang na busy si Sir Michael because, he just lost his brother. So anyway, we'll just continue with Dr. Sam. Congratulations. Mukhang you are now a full-fledged naturopathic practitioner.
Hindi pa, Doc. Nantay pa namin result. But anyway, submitted na po yung mga documents na kailangan.
Okay lang, Sir Michael. Asikasuhin mo yung mga yung mga bisita. It's okay. Let's go to Dr. Sam. Yeah. 21 to 25. Are you enjoying 21? This so far? I hope you don't mind. I'm so inquisitive. This is what we should be good at. We ask questions para sa kinabukasan ng ating, para sa ekonomiya. Okay. Dr. Sam, 21.
Yes, Doc. Good evening, everyone. An elderly patient has the following signs and symptoms: constipation, lassitude, or shortness of breath, dizziness, palpitations. palpitation, pale and lusterless complexion, lips and nails, a pale tongue with a thin coating, a thready and weak pulse. Now, which of the following methods would you use to treat this case? So,
to the answer right away.
okay. Due to the palpitation, we can see here palpitation and constipation. That is actually a sign of a heat. So therefore, I would like to use this method. Hold on.
I have a clue. I'll give you a hint.
Yes.
If you're like, parang having doubts, tingnan nyo muna kaagad yung tongue and pulse.
Yes.
Unahin nyo talaga tingnan niya para doon na tayo maging biased. Okay, when you look at the tongue, Dr. Sam, what is getting inside your head? Pale tongue.
So actually, so pale tongue is definitely it's either blood or chi deficiency. So with a thin coating.
Yeah, chi deficiency.
Yeah, chi
what
deficiency.
About the pulse?
The pulse is steady and weak. Oh, manipis. So therefore, that is a blood deficiency.
So if it is deficiency, you need to reinforce, right?
Yes, reinforce.
Or
and that's why
the correct answer.
The correct answer is gonna be D, reinforcing the chi and blood.
Okay, very good. So actually, when you have a thready pulse, you would be thinking of blood deficiency.
Yes.
Diba? And although the tongue doesn't look dry and meron na siyang thin coating is normal. Pero pale tongue. So pale tongue, thin coating, that's chi deficiency. Nothing so serious pa. That's actually the start of everything. So pag nag-laboratory ka, walang makikita. And this is where we should all excel. You should be able to already address the issue before it gets worse. And it's always good to always to refer, no? Para marami din tayong friends sa sa ating medical counterparts. Let's go to number 22, Dr. Sam.
Yes, number 22, the best prescription for treatment of lower back pain. Wow. So is if lower back pain, that would definitely involve bladder 23, that is the backshore points of the kidney.
Okay.
So and we're gonna be using DO3 also because DO3 is for lumbaroscal pain. So that's actually, I think, gonna work.
It actually strengthens the lumbar area.
Yes, that's the function of DO3.
Wow.
And bladder 40.
Yeah.
Bladder 40.
What kind of, anong category ni bladder 40?
So bladder 40, hold on.
This is a favorite, diba? But you need to know why.
Oh. So bladder 40 actually is what do you say? What's the point? What's the point? And this is
command point of the lobe.
The command, the command point of the lumbar.
Yes.
So this is actually very effective for lower back pain.
Very effective. And I have something to ay nako, if you only knew, no? I'll teach you one technique. Bladder 23, di ba? It's in the lumbar between L2 and L3, di ba? So hanapin mo yung lumbar area doon sa scalp using the jaw scalp acupuncture. And you also have to look for the bladder 40. That means the gluteal area. Okay. Kung gusto mo pa rin mag-experiment, you use it on the ear. No? What I'm saying is, if we consider the ear as the microcosm of the human body, by minute representation. So, di ba mas maganda if you can accurately locate by using the probe the actual location of the points doon mismo sa ear. Isn't that fun? So let's make it more interesting. Let's innovate para sa kinabukasan. Okay, so yun. I'm very sorry for your loss, Sir Michael, ha. You can be excused.
Okay lang po. So meaning, Doc, we can create our own pattern.
No, you don't create your own pattern. You can actually use your own modality.
Modality. But we can mix some modalities like
Yes.
irregular and body.
Katulad ng like when you have stroke, it's always good to find, kasi di ba, you have your EA, electro-acupuncture.
Yes po.
According to my source, kailangan yung gagamitin mo lang 1 pair. Maximum of 2 pairs dun sa may ulo. No? And ang challenging sa scalp is how you're able to needle without the patient feeling any pain. And there is a technique where you have to be able to feel kung talagang pumasok ba. No? Yon. There should be no pain. Kasi if there is pain, it's either too shallow yung pag-needle mo sa scalp or too deep. You have to needle as far as the fourth layer of the scalp, which is the areolar, the loose areolar tissue. Yeah, the loose areolar tissue. Okay, so much for that. Let's go to number 23.
All right. So in addition to the main points such as bladder 23, do 3, and bladder 40, as mentioned in the last question, which of the following points would you use to treat lower back pain due to traumatic injury? So the keyword here is traumatic injury.
Okay.
So I would go for do 26. So that is for acute lumbar pain.
Okay, yung nahulog sa di ba, sa hagdanan, di ba? So what is the classification of do 26?
Do 26 is no one do 26. Hold on.
It's actually a crossing point. Crossing point.
Yes. Crossing points of do and large intestine and stomach meridians. Small intestine, stomach and large intestine.
So it's the do meridian with the Yangming, stomach and large intestine. So this is meridians yan, ha. So ibig sabihin, sa large intestine area, you're talking about the arm na nahulog. Diba? How would you know na the large intestine is involved? Pag hindi niya maalsa, di ba? If we've learned the shoulder, shoulder.
Yes.
Pag hindi niya maiabot dito, so it's
hindi niya
pag hindi niya ano dito sa likod, it's probably the small intestine, hindi niya matanggal yung bra niya. Or mai-clasp yung bra niya. But if it's hindi niya ma-lift ganon sa side, it's the
large intestine.
Yeah. So Yangming. And then also the same thing with the foot. No? So yun. Okay. So do 26 is actually the crossing point between the do muscle and the Yangming channels, stomach and LI. Diba, ang dami nating natutunan ngayon. Imagine the best prescription for low back pain. I hope it would stick sa utak natin lahat. Kaya nagtataka ako bakit hindi masyado nagpupunta yung iba. Are we going to presume that they know a lot already? And then nakikita ko puro matatalino yung nag-a-attend. Okay, anyway. Number 24.
Okay, number 24, which of the following points would you utilize as a secondary points to treat lower back pain?
Oh, yeah.
Caused by a deficiency of the kidney.
Yes.
So that is kidney. So that's going to be do 4 can help.
Yeah.
Yeah.
And how are you going to needle it? Going up or going down?
Do 4 is going up, Doc, kasi you have to go with the flow.
Ang galing. Okay. Are you familiar with this extra point, Yaoyan?
Yung Yaoyan, Doc, I really don't know about Yaoyan. Which, saan ba located?
Actually, mababa pa sa may lumbar 4, lower border. So imagine mo yung bladder 23 is
Yeah.
between L2 and
Yeah.
lumbar 2 and lumbar 3. This one is below lumbar 4, but it's located 3.5 soon lateral.
Lateral.
Yeah.
Okay.
Okay. So aside
3.5.
from, of course, you can do moxa if you want. Do 4, it's so powerful. And Yaoyan, I'm not so familiar. In fact, I'm planning to do a video on all the extra points. Required pala tayo mag-memorize ng super daming extra points. And this is just one of them. I think PTOC is listed like 50 points, extra points. Okay. So, ang ganda, di ba? So, yung low, alam naman natin kung bakit, kung ang cause ng low back pain is yang deficiency. Okay. Kidney yang deficiency. Let's go to 25, Dr. Sam.
Choose the best prescription for a patient with the following signs and symptoms. Una, insomnia, dream-disturbed sleep, dizziness, palpitation, poor memory, spontaneous sweating, anorexia, lassitude, a pale tongue with a thin coating, and a 3D weak pulse. Wow, ang daming sitwasyon.
Actually, kaya this is what I'm telling you. Unahin mo yung tongue and pulse. Okay, let's analyze the tongue first.
Okay, the tongue is pale. So pale tongue with a thin coating. So a pale tongue
deficiency
is a Qi deficiency. So and thin coating, it's a thready and weak pulse. So that is another deficiency. So
thready could be blood deficiency, probably.
Yeah, blood deficiency. It's blood daw kasi weak nga yung pulse niya. But that can be cold. So
you look for the most outstanding what's this symptom there? You have insomnia, palpitation. So that's already telling
palpitation.
Yeah.
Yes. And if we can check on palpitation and insomnia, that's definitely gonna choose heart 7.
Okay.
Yeah, heart 7, and then spleen 6. Yeah, I think it's
una mo nga hanapin the backshoe of the heart.
Yeah, the backshoe of the heart is bladder 15.
Okay, good.
Bladder 15. And then we have
why are we using your answer is letter D, no? So
yes, the answer is
using bladder 20 here.
Bladder 20 is actually good for insomnia, bladder 20.
Yeah. Why? So like what pattern are we talking about here? So bladder 20, we're talking about the spleen and the heart. So what pattern are we exactly talking about here? Okay.
It's
yeah, sorry. Ma'am Darlene, you'll be next, Ma'am Darlene. From 26 to 30. Okay. Yeah, bladder 20. So ganito po yon. Una-una, you have palpitation, poor memory. Okay. Spontaneous sweating. Ibig sabihin, kahit hindi mainit, pinapawisan ka. So that speaks a lot about Qi deficiency.
Qi deficiency.
Anorexia is very spleen. Lassitude is very spleen. So we're talking about so pag mahina ang spleen, kasi may insomnia, may dream disturbed sleep. So we'll be looking at a shen that is not housed. The yin or blood. Okay, so we're left between heart blood deficiency or heart yin deficiency. So pag heart yin deficiency, kailangan meron tayong nakikitang night sweat. Are we seeing night sweat? Are we seeing 5 heat?
Wala, Doc.
Wala. So it's probably heart blood deficiency.
Yeah. Yes.
Okay. Bakit kayo nagka-heart blood deficiency? Probably it's because kulang yung production ng blood.
Yes.
Spleen.
That is because of the spleen Qi deficiency.
Very good. So we have spleen Qi deficiency with heart blood deficiency.
Yes. So
Okay.
that's why we select also the bladder 20.
Yeah.
Yeah, bladder 20 actually is the backshoe points of the spleen.
Okay, very good. Bakit natin hindi in-answer si letter A? Are we seeing something for the kidneys? No.
With this kind of issue, Doc,
Wala.
wala namang kasing kidney na involved dito.
Okay.
So it's actually with blood deficiency doon sa heart or the production of the blood that is actually with regards to the spleen.
Okay.
Pero we do understand that we need also kidney yang in order for the spleen to function well.
Very good. Yeah. Congratulations, Dr. Sam. Good job. Excellent job. Thank you so much. Let's now
Thank you,
go
Doc.
to Ma'am Darlene. After Ma'am Darlene, I'm going to call on Ma'am Ami, 31 to 35. Okay lang? Tapos ni Ma'am Ami, si Ma'am Jelisa, 36 to 40. Okay. Ma'am Darlene, how are you doing? You look so, parang ang dami mong inaral. So, okay.
Try.
Happy
Good
ka ba
evening
sa
po.
mga
Good evening,
questions?
Doc.
Yeah, good evening, Ma'am Darlene. Happy ka ba sa mga questions ngayon? Do you think they are very useful in
Hindi
our
ko po alam kung
practice?
ma-absorb. Ang dami-dami, Doc.
Sabi ko, wag niyong i-memorize. Kailangan niyong intindihin.
Yes po.
Diba?
Thank you po. Ang daming natututunan every time, more and more.
Wow. O sige, be prepared for more. O tingnan nyo, are you happy, Ma'am Annalyn? Look at the face of Ma'am Annalyn. Gusto pa niyang sumagot ulit. O, diba? Like this one, the best points for the treatment of insomnia. So remember, you have to also justify why the other options are wrong. Okay,
Hindi
Ma'am
pa ako
Darlene,
magaling dito, Doc.
Ha?
Hindi pa po ako magaling dito.
Kaya nga tayong may review, may assessment. Hindi naman tayo
Yes po,
pina-firing
Doc.
squad. Okay. So anong sagot mo? Sagot ka agad po.
Number 26, my sagot is letter E. Because insomnia is heart. So, nandun si heart 7. And
What's so special about heart 7? Why do we use it for insomnia? Ano pong role niya? Napaka-popular niya.
heart 7.
Diba, we need the heart to be able to house the Shen. Kailangan ng Shen na merong residence. And pag walang kwenta yung heart mo, if you have heart blood deficiency or heart yin deficiency, which is a worse situation than heart deficiency, then we're going to have a problem. But my question is, bakit napaka-popular ni heart 7? Una-una, how do we classify heart 7?
Heart 7 is shoe stream, Doc.
Okay. And it's also the yuan source. Kasi yin channel siya. So when it comes to insomnia, we're talking about housing the Shen. So we have to make sure that the heart is in tip-top shape. Or we try to improve the heart function. So we use the shoe stream or the yuan source. Pareho lang po yun, heart 7. And what about spleen 6? Ano pong kinalaman niya sa insomnia?
For spleen 6 is for the patients.
Actually, ang tawag sa spleen 6 is San Jin Jiao. 3 yin intersection. Ibig sabihin dito nag-intersect si spleen, si liver, si kidney. Okay, ang tanong ko is, does this really affect sleep? Spleen, liver, kidney?
Yes po, Doc.
Very good. Go. What do we need the spleen for?
Siya po yung nagsusupply ng
blood
blood
and chi.
flow.
Very good.
Yes.
And what do we need the liver for?
Liver is where the blood store.
Okay, stores blood. What about the kidney?
Kidney, this is the
It is so related to the heart, right?
yes po.
It communicates
Because this
with the
is
heart. The water element, and heart is the fire element. Okay? Kaya nga, if you see a red tongue or a tongue with so many cracks, what are we talking about? Okay, before you answer that, ang heart and kidney, they have a very good relationship. It's like water and fire. Kailangan ni heart si kidney para hindi siya masyadong mainit. Kailangan ni kidney si heart para hindi siya masyadong malamig. So, for people who have very pale tongues, moist tongue, ano ang problem doon? So, pag meron kang yang deficiency or yin deficiency?
moist
cold.
is yin deficiency po.
Feeling cold.
Ah.
Moist tongue. Moist. Swollen tongue. Pale tongue.
It's yang
Yang
deficiency po.
deficiency. So most likely mahina din yung heart niya, no? Bakit? Actually, ang heart ang mahina. Hindi nakapagbigay
Blood
ng
flow.
hindi nakapagbigay ng fire yung heart. Kasi to start with, mahina ang heart.
Yes po.
Okay? What about people with yin deficiency? So, pag merong yin deficiency, ang kidney, will it affect the heart?
Yes po, Doc.
Okay.
Because the kidney yin is for essence, blood, and for the fluid po.
Okay. So kung may kidney issue ka, be careful of the heart.
Yes po.
And that's the reason why people who work so hard, people who are losing their hair and teeth, or tinnitus, they have to take care of the heart. Ano nga hanapin mo sa earlobe to find out if you are prone to it? To heartache?
To heartache is the heart.
No,
heart
not
point.
heartache. Yaan mo na yung heartache. It's the
kidney.
Ikaw talaga madrama ka heartache. Okay. Dito sa Frank sign. Remember? Hanapin mo dyan. Saka paano mo malalaman na isang tao dapat hindi siya madaling ma-stress? Meron siyang tinatawag na constitutional weakness of the heart, which you see on the tongue. What do you call that? You will have the heart crack, remember? Which
Yes,
can
po,
extend up to the tip of the tongue. So these people, they may not have a heart problem yet, but they should avoid being stressed. And most of these people are emotional. Okay? Anmian, I want you to read on this and locate the Anmian. It's so effective. It's an extra point. So meron na tayo natutunan for low back pain due to cold, Yaoyan, no? Yaoyan, remember? 3.5 tune lateral to the it's a lower, below the spinous process of lumbar 4. Okay? Yan.
Yes po. Yan next.
Yan. So alam nyo na yan. Okay.
Yes po. Below lumbar 4, 3.5 yun lateral.
Okay. Do you think there are people who have insomnia? There are many patients with insomnia. Huh?
Yes po, Doc.
What are the best points without looking at your notes?
For insomnia is
Yes.
heart 7, spleen 6, and the amnion extra point.
Very good. Okay, let's go to number 27. First, before you answer that, how do you define palpitation?
Palpitation is for if there is an abnormal palpitation, then there is a heart deficiency.
No, I wanted you to define palpitation.
Ah.
Paano mo ma-extract yan sa pasyente? Sasabihin mo ba, mayroon kang palpitation? Kailangan gumamit ka ng ano. Kung yung natapos lang yan, hindi pa siya nakatapos ng college or kahit high school.
Doc, tatanungin mo kung yung pulso niya ay may pulso pa ba siya?
Hindi, kung narinig ko
Pumipitik.
yung heartbeat.
May heartbeat po.
Kasi I had one patient, sabi niya, abnormal pala yun. Kasi narinig niya yung heartbeat niya. Yan, okay. Ma'am Annalyn, ikaw talaga, siguro absent ka, Ma'am Darlene. So I think I should call you more often. Be confident, no? Don't let fear, you know. I don't bite naman eh, di ba? So Zoom lang to. Anyway.
Yes, Doc.
So, palpitation, nararamdaman niya, naririnig niya yung heartbeat niya, whether fast or slow. Some people would always say fast heartbeat, no? As long as you can hear your heartbeat. So you're not supposed to hear it. Okay, let's go to your answer for number 27.
Number 27 is letter A.
Why is that? Okay. What is bladder 15? How do you classify bladder 15? Back shoe of the Are you familiar with the back shoe points, Ma'am Darling?
Hindi pa.
You should be familiar, ha? You should be familiar.
Opo, Doc.
All of them, please.
Yes,
Back shoe
Doc.
point of the heart. What about Shenmen? Ano yung kanyang classification? Kasasabi mo lang kanina.
Yes, ano po, shoestring po.
Or Yuan source point.
Or Yuan source point po.
And what about pericardium 6?
Pericardium 6,
do you use it often?
Do
you use it often?
Not very often, but I did use this one a few times last week, Doc.
And how does it work?
Yung sabi ng patients kasi, Doc, ano siya, yung response niya to things is para siyang nag-calm.
Okay. Actually, the PC6 is the luo connecting point of the pericardium channel. Pag sinabi mong luo connecting, may impact siya sa partner niya na yang. Okay? So nakakapagkalma siya, no? It opens the chest and it also regulates your heart chi. It actually calms the shen. Okay? And it harmonizes the stomach. Good. Okay, why are we using REN 14? What is REN 14? Front mu point of the heart. No? Front mu point of the heart. So it's so good for acute conditions, actually, especially yung mga ano pala. And we would like to presume that the palpitation, it's also a chronic one. So that's why we have the back shoe. Okay, so bladder 15, heart 7, pericardium 6 to regulate the heart chi or calm the shen, and also REN 14 to deal with palpitation currently, the front mu. Okay, let's go to number 28.
Apart from the main points such as Shenmen, Heart 7, B15, P6, which of the following points would you select as supplementary points to treat palpitation due to the retention of pathogenic fluid?
Okay. Ito yung mga pasyente na meron ng edema. Diba? Pag may heart problem sila, may palpitation na kaya binibigyan lang sila ng gamot for that. So if we can come in and we would know what to do, then masaya ang patient, diba? So kanina, ito na, memorize natin yung heart 7, bladder 15, pericardium 6. And if the palpitation is due to retention of pathogenic fluid, no? Kasi pag sinabi mong palpitation, it is actually an attempt of the heart to make up for kasi nag-swell na. So kailangan, kasi pag nag-swell siya, medyo mahina na. So kailangan niyang, mag-double time. Yan. Okay, your answer is?
Letter B, Doc.
Yeah, because your goal is to get rid of the fluid. Okay? So what is so special about REN9?
For this 3, Doc, mas ko sa spleen 9, REN 9.
No, you use all. Actually, REN9 is very good for edema. No? Because it treats edema. It opens and regulates also the water passages. So I presume you know how to locate it. What about REN4? Bakit natin ginagamit si REN4? Kasasabi lang ni niyang kanina, ni Sir AK. REN4. It is a very nourishing and strengthening point. And what does it actually, ang dali lang ma-locate niyan from the belly button, di ba? And by the way, how do you locate REN4? Yes? Okay, sige, ganito na lang. Okay. So sana kasi this is all for our koan, no? Actually, CB4 can tonify as well as maintain health. Siyempre, ayaw natin tumanda ng diba? Kulang tayo sa yin. That's the reason why some people look older. So if you want to look young, you have to take care of the yin. What about spleen 9? What is the classification of spleen 9?
It's a Hesse point po ng spleen.
Okay. So
Water.
you have to remove the pathogenic fluid using spleen 9. Very good. Okay, 29.
Which of the following points would you select as a supplementary points to treat a patient with the following signs and symptoms? Palpitations, tinnitus, dizziness, blurred vision, very little tongue coating, and steady rapid pulse. My answer is letter D, Doc. Kidney 3 and bladder 23.
Okay, ano yung diagnosis mo dito?
Diagnosis
Very
is
little
little coating. Sa tongue po is very little coating. And steady sa pulse po, rapid.
Ano to? Is it a heart yin deficiency, heart blood deficiency, or?
Yung sa
Palpitations, tinnitus, dizziness, blurred vision. Saka sabi mo, kidney 3 and bladder 23.
kidney heart deficiency po, Doc.
I'm sorry?
Kidney heart
Ano?
Kasi yung palpitations, it's hard.
Kidney-heart disharmony. Oh, pero
Opo,
if you
Doc.
look at the okay, when you say blurred vision, it doesn't always mean the liver, ha? Okay, tingnan mo, di ba sinabi ko, tingnan nyo yung tongue. Very little tongue coating. So what pattern do you have in mind pag maliit na lang yung tongue coating?
Yin po.
Yin deficiency.
Yin deficiency po.
And what about thready rapid pulse? That's rapid.
It's
Do we have heat here?
heat po. Heat makes the pulse move faster po. That's why it's
Saan nanggaling yung heat? Empty heat, di ba? Di ba sinabi mo, konti na lang yung tongue coating, so we're looking at kidney deficiency. Of course, when you have kidney deficiency, the liver is also affected. Kaya meron kang dizziness, blurred vision, okay, tinnitus, and then palpitations. Kasi eventually it has affected the heart already. So, but it's basically kidney yin deficiency. Okay?
Yes po.
With empty heat. Pero hindi pa naman red yung coat. Pero hindi talaga nila nilagay yung itsura ng tongue. Anyway, let's go to number 30.
The prescription formed by REN 3, stomach 29, spleen 10, liver 3, liver 4, and spleen 6 is most appropriate to treat amenorrhea caused by blood stagnation.
Okay. Alin dito sa mga points will tell you that you're dealing with blood stagnation?
Liver 3 po, Doc.
Okay. What else? When do you use spleen 10? I want you to be very familiar with the points.
Yes, Doc. We need to use this spleen 10 for the chi flow po.
No, to move the blood.
To move the blood.
Okay, so ibig sabihin, it's Li4 and spleen 10. Okay? And blood is yin, so we're looking at spleen 6. What about stomach 29? What is so special about stomach 29? Actually, stomach 29 is very good for blood stagnation as well. So it's very good for women with blood, who have menstrual problems. So, pag sinabi mong amenorrhea, anong klaseng pattern are we talking about here? Which is the result. Definitely, sinabi mo blood stagnation. So pag may blood stagnation, anong nangyayari sa blood? Blood supply. Siyempre, hindi na tumatakbo yung blood. Amenorrhea. What do you mean by amenorrhea?
Kulang po sa dugo, Doc, ang amenorrhea.
Hindi nag-mens masyado, di ba?
Opo.
So, of course, pag blood stagnation, meron ka ring blood deficiency. Kaya gumamit tayo ng spleen 6, kidney, liver, and spleen. Li4, so stomach 29 is also good for blood stasis, especially menstrual problems. Okay, so stomach 29, spleen 10, and what about REN 3? Anong classification ng REN 3? Front mu, di ba?
Yes, po, Doc.
Front mu ni ano? Front mu of Rentry, this is very important. You should know these things. Front viewpoint of the urinary bladder. No? Ito din yung crossing point ng Ren vessel, pati yung tatlong yin meridians. Ano yung tatlong yin meridians? Spleen, liver, and kidney. Okay? So study more, study harder. Ma'am Darlene.
Yes, Doc. Yes po, Doc.
And I expect a better performance next time. Don't be disappointed. I hope you should instead you should feel motivated. Okay?
Yes.
Sige po. Maraming
Thank you
salamat.
po, Doc.
Let's go to Ma'am Ami. Nakangina pa yata ready from 31 to 35. And then we'll call on Ma'am Jelaisa. Ma'am Jelaisa, andyan ka pa ba? Andyan pa ba siya? Andyan pa. Okay, good. And
Yes, Doc.
okay, very good. You're for 35 to 40. Let's call on Ma'am Ami. Ma'am Ami, good evening. Alam ko late na, pero I hope you're enjoying it. Ay, dyan pa ba siya? Naku, mukhang wala pala. Wala na wala si Ma'am Ami. Okay, kayo na lang Ma'am Jelaisa. From 31 to 40. Okay lang? Nawala si Ma'am Ami.
31 to 40, Doc.
Opo, yes. Kayang-kaya. Go. Easy lang to.
Good evening, Doc. Number 31 to 40. Start na ako, Doc.
Sure.
Watery stool with congested food implies letter A, deficiency of yang of the spleen and kidney. Ito kagad namin. Wala siyang ano, papipilihan niya ng
32.
AMs.
Ang galing 32.
Number 32. Blood in the stool with the mucus and the burning sensation in the anus result from letter D, damp and heat in the large intestine.
Nagkaroon ka na ng pasyenteng ganito?
Meron na, Dok. Nag-ano po siya? Ay, wala, Dok. Wala, ano siya,
wala
Dok,
pa?
ay masyadong severe.
Okay.
Severe to, Dok, pagka nag-stool na yung, nagbo-blood na yung dumi. Severe na to. Wala pa akong
May mucus, burning. Baka hindi mo lang tinanong. Hindi naman kailangan yung dumumi sa ano, di ba?
Opo. Pero ano, Dok, kadalasan, Dok, ano, severe na to pagka mayroon ng ano eh. Ano to, Dok?
Chronic na.
Kadalasan tawag nito, Dok, di ba, ano?
Okay, number 33, Ma'am Jelaisa.
Number 33, the damp heat in the spleen and the stomach result in letter B, a sweet and a sticky sensation in the mouth.
Oh, di ba?
Pagka daw may damp heat tayo sa spleen and stomach, result daw po. Meron tayong sweet and
Nararamdaman mo din
sticky
ba yan, Ma'am
sensation sa...
Jelaisa? Sweet and sticky sensation?
Yes, Doc.
So, can you relate?
Yes, Doc. Opo, Doc. Kasi sa insomnia to.
Okay.
Sa insomnia
Number
rin to.
34.
Number 34. The fire of the liver and the gallbladder result in letter A. A bitter taste in the mouth.
Very easy. Actually, these are old questions, no? Imposibleng makakalimutan yun. Number 35 to 37.
35 to 37.
Prolonged menstrual cycle. Mahaba, matagal yung
The prolonged menstruation cycle with scaty, published that discharge.
Blood clots, ha? Halatang halata na yung blood clots, ha? Obvious na obvious.
Just, ano po, letter C, tasteless, ano? Ay, letter C, stagnant na blood.
Stagnation. Blood clots, ha? Purplish dark discharge. Tapos kokonti lang. Usually may masakit. Okay, number 36.
Stagnation of blood.
Menstruation.
Number 36, means of shortening cycle, excessive menstrual flow, pink and deep red in color, relates mainly to excessive heat in the blood.
Yes.
Mainit
Deep
yung
red.
excessive heat in the blood.
Makapal, thick,
Ma-red.
red. Okay, number 37.
Number 37, produce tint and light colored menstrual blood flow indicates disharmony of the chong and the red channel to the obstruction of liberty.
Okay.
Ayun daw kasagot ko. Pagka-produce na light.
Isipin mo buti ang light
More
color.
illustration to the
Marami siya pero manipis. Light color.
light,
What the
pero matubig po. Excessive heat in the blood.
Anong sagot mo? Profuse?
Letter number 30. Letter B, Doc.
Failure of chi to
Ay, sana ba
control
tayo?
the blood. Okay, let's go to number 38 to 43. O, di ba lahat na sa'yo? 38 to 43. Sige, let's start with number 38 muna. Ano yung 38? Actually, review lang to no?
Yung think.
Sputum.
Na ano natin, natakel na natin to eh.
Oo, so
natakel
alam mo
na
na yung
natin to
sagot.
dati.
Alam mo na yung sagot.
Opo. The things with
Thick sputum, tapos
Opo,
mabaho.
Doc.
So what is your answer for number 38?
Smell suggests accumulation of phlegm heat in the lungs.
Yes. Phlegm heat.
Suggests
Para bang
meron
damp?
siyang ano sa lungs.
Pero ito lang, phlegm. Maraming sputum. Tapos mabaho. So amoy-amoyin mo rin. So phlegm heat. Okay, number 39.
39, dilute, clear, and odorless sputum suggests accumulation of cold. Ganun pa rin, Dok eh.
Cold phlegm.
Diba?
Cold phlegm. Kasi ano siya, clear, hindi mabaho. Diluted. Cold phlegm. Yung isa, phlegm heat. Okay? Number 40. Inuubo, tapos paos.
Number 40,
Course in a
cold in the course voice usually suggests letter C and D. Invasion of lung by wind cold and accumulation of cold phlegm in the lungs.
O, di ba? Yung isa, external invasion. Yung isa naman,
Dok, yung ubo niya,
yes.
Internal.
Coarse voice. So, parang garalgal, no?
Yung boses.
Oo, maplemas. Or malamig. Okay, number 41. Cough, tapos clear voice.
Number 41, yung cough niya, clear voice, usually suggests dalawa, Dok eh, E and F, invasion of lung by wind heat and accumulation of phlegm heat in the lungs. Same din, Dok. Parehas siya.
Oh, di ba kung may phlegm heat ka, hindi naman affected yung boses mo, di ba? Okay, so E and F, cough in a clear voice, invasion of the lung by wind heat, accumulation of phlegm heat. Basta may heat. Okay. Number 42.
Cause breathing accompanied by asthma and crackling sound of sputum suggests excess syndrome of phlegm heat in the lungs and excess phlegm dampness in the lungs.
Okay, excess syndromes of phlegm heat. Yeah.
May dampness.
Phlegm heat, phlegm dampness. Kasi may rattling sound din, di ba? So, May
Yes,
phlegm.
yes, Doc.
And number 43, so dalawang answer, A and B. Number 43,
Opo. Yung number 43, yung dry cup with letters mortum suggests injury of the lungs by pathogenic dryness and a long-standing deficiency of the lungs.
yeah, basta tuyo.
Sa yung
Huh?
dry na
Tuyo
cup,
and heat. Dry
Opo,
cough.
sa tuyo na po, tapos konti lang.
So, pag meron kayong pasyente,
Meron daw po
dry,
si injury.
walang plema.
May dry cup, may injury of the lungs.
Okay, maraming salamat, Ma'am Jeliza. You're improving.
May tunog lang, pero
O, di ba? Specialize mo na yan, puro plemas, pati puro menstruation.
thank you, Doc.
Okay? Thank you. Good job. Let's now call sa last. Siguro kayang kaya na to hanggang 50. Thank you po. Ma'am Lane Arandia. Ma'am Lane, are you still awake? Yeah, very good.
Yes po. Number 44 often indicates excess of heat in the interior due to invasion by exogenous pathogenic heat. Pag mayroon po siyang indicate ng excessive heat, ito po yung letter A, sustained high grade fever.
So pag hindi bumababa yung fever, tuloy-tuloy, nasa interior na po yan, no? Ano po ang itsura ng tongue?
Red po.
Okay. Red ka agad. Sustain na pala. Red na. So ito dapat nire-refer na. Baka mategi yung pasyente, no? Okay, letter B. Letter B. Number
Letter
45.
Number 45 often indicates endogenous heat caused by deficiency of yin.
Okay.
Letter B, a slight fever occurring at a definite time of the day. And letter C, fever sensation conveyed to the body surface from the interior. And the last, yung a feverish sensation on the palms of the hand and soles of the feet.
Okay, so if you are doing massage, you should note this, no? So kung mainit po yung palms and soles, you will probably think na meron po siyang heat sa loob dahil may yin deficiency. Then you also have to look at the tongue kung may coating pa ba or wala. And last, number 46, Ma'am Lane.
Often, wait, naputol. Number 46, often indicates transmission of exogenous pathogens from the exterior to the interior. Letter A po siya ulit, Doc. Sustained high grade.
Okay. Anong magiging
Fever.
itsura ng tongue para medyo kampante tayo na matutulungan natin yung pasyente? Like, how do we know? What do we look for in the tongue to find out if exterior pa yung condition ng patient? Ibig sabihin, hindi pa siya nag-i-interiorize.
May spots pa po siya sa
Okay, may spots na sa side and tip. Very good. So, pag yung spots lumipat na lahat sa center or nag-yellow.
interior na po.
Okay, very good. Great. So matatapos na tayo. Last 4, finally.
Number 47, thickness and sweet taste in the mouth most likely suggests. Pag may thickness, tapos sweet taste, involved po siya sa spleen.
Okay.
Kaya damp heat in the spleen, letter D.
Okay, very easy. 48.
A bitter taste in the mouth suggests. Pag sa bitter taste naman, lagi po siyang indicated po ng related po siya sa organ ng liver and gallbladder. So letter C, hyperactivity of fire of the liver and gallbladder.
Anong difference pag may heart fire? Heart fire sa liver fire. Di ba bitter taste din sa heart fire?
Ang heart fire po is
Pagising lang.
palpitation, mental.
Oo. Yung bitter taste, pagising lang eh. Lalo na pag hindi nakatulog. Ang bitter taste the whole day, that's liver and gallbladder fire. Lalo na pag nagalit ka, then na-stroke ka pa. Lalo ka nagalit, na-stroke. I had a patient like that. Nalaman niya medyo, hindi lang pala siya ang, ay, maritas na naman tayo. Kaya pala hindi sumama sa kanyang tour dahil medyo mas bata-bata pa. Kaya you have to prepare yourselves for the worst, no? Kung ayaw mo ma-stroke. But this is easier said than done. So yung complaint niya, yun nga, na left-sided paralysis siya. And she would always tell me, Doc, bakit masyadong mapait yung panlasa ko? So, kasi hanggang ngayon, syempre hindi na siya gumagaling-galing. Yung yung attitude mo rin, kailangan mo talaga makuha yung And at the same time, wala ka na magawa eh. Dalaman kasi niya na hindi lang siya ang nagmamay-ari nung niya. Ay, malako, masyadong marites na. But these are the things that you have to consider. No? So, yung mga medyo galit, tapos nahihiyang magwala, alangan naman magwawala ka. So you have to break your most expensive Chinaware or break the eggs para tipid din lutuin mo pagkatapos. Or go to the beach and shout at the top of your voice. Okay? And then life has to go on. Unless gusto mo ma-stroke. Siyempre pag na-stroke ka dahil sa galit mo, lalo kang magagalit. So, yun lang. Okay, number 49.
Number 49, foul belching and acid regurgitation suggests. Ito pong may acid siya sa foul belching. Sa letter B po, retention of food.
Okay, very good. And number 50?
Ay, shit. Teka lang. Nasarado ko. Poor appetite, loose stools, fullness in the epigastrium and abdomen suggests. Ang sagot po is letter A, weakness of the spleen and stomach. Yung poor appetite, loose stools, indicated po siya na spleen chi deficiency. Kaya po, letter A po siya, weakness of the spleen and stomach.
Okay, maraming salamat, Ma'am Lane. Did you enjoy tonight's session? Hindi ba
Yes
kayo
po, marami pong
nagsasawa?
natutunan.
Are you learning anything like every week?
Yes po, nagre-review po kami ng
Kailangan yung mag-aral
recording.
mo.
Opo.
Okay, so do you think yung kaalaman ninyo for the past 16 weeks medyo sulit?
Nadagan Doc yung knowledge namin.
Napansin niyo pa ulit-ulit lang yung question?
Yes, Doc. Doc, may nakatakal din natin iba dito.
Hindi gusto ko malaman kung natiintindihan nyo talaga yung iba. Okay. Actually, bago lang yung question, yung mga paulit-ulit lang. Diba? And always remember this. When we have sessions like this, you should always, of course, I give the questions ahead of time, then you have to look for the answer. And aralin nyo din bakit mali yung ibang choices. And I'm very particular about classification of the points. You need to know this thing. Hindi yung, kasi yun ang tinuro sa akin, no. Diba? Just like constipation. Oh, si Sir AK, I was so impressed. Pwede na siya mag-lecture about constipation. Diba? Yun, pakainin nyo na ng maraming fiber yung pasyente nyo. Minsan kung hindi naman dahil doon, diba? Wala ring mangyayari. So, yun. And also, what else? Let's ask Sir Henry. Sir Henry Nilios, medyo, don't worry, hindi kita tatanungin. How do you find our training so far? Sir Henry. Naku, mukhang natulog na yata. Ngayon ko lang nakita yung name. Okay.
Hello, Doc.
Hello, Sir Henry. How are you?
Okay naman po. Medyo...
Yeah. So I remember you messaging me about ano ba yung therapy? So pinilit kitang mag-attend, 'di ba? Nagsisi ka ba, Sir Henry?
Hindi naman, sir. Doc pala, oo, marami akong bagong learning to class. Meron pala ganun regular.
Pakita ka naman
Maganda
ng
siya.
mo.
Teka lang.
Excited si Ma'am Jelisa. I'm sure. Ay,
Ayan po.
wow. Parang ano, universe.
Blurred.
Okay.
Ngayon. First, you were inviting me kanina, di ba? To
Yeah, I
log in.
invited you because I wanted you
Yeah.
to probably
Salamat.
volunteer and answer.
At least
Fine.
na-expose ako sa ganitong Q&A. And
Oo.
then assessment.
Na-amaze ka ba kung gaano kagaling ang ating mga
Oo
student?
nga eh. Parang ano ako newbie, baguhan. Na-overwhelm ako sa kanilang
Galing
knowledge.
nila.
They are gone, so far na, they are, tawag dito, advanced. Meron na silang advanced when it comes to
Oo
acupuncture
naman,
and then
16 weeks na.
assessment. Oo nga eh.
Bakit sa
Ako,
iba ba hindi advance?
Hindi. First time ko kasi ganito, acupuncture. Kasi galing ako sa massage.
Oh, okay. Alam mo ba, Sir Henry, pangarap talaga ni Doktora Palangka is to upgrade all LMTs, no? Kasi una-una, mukhang, di ba, isang oras, isang pasyente. Di ba? Buti sana kung marunong kang ano to? Yung bone setting, yeah, whatever. And also, meron pang isa, there's a term na medyo you charge 5,000 per session. Okay. Chiropractic. Okay.
Chiropractic.
Okay. Diba? So, it's good to always have a lot of skills, especially ngayon. Ipapakita natin na we are on top of, we lead the pack. And we're not only good at, but we really know what we're doing. Kung napapansin mo, Sir Henry, they're so good at diagnosis, diba? This is how we do it in LAM. Okay? We may not be charging too much. Actually, kami nga pinakamura eh. And don't ever think na mura yung inyong tuition na medyo low ang quality. I don't believe so. Sa totoo lang, ang LAM Foundation, we're not particular about pricing, but we're more particular about the quality of students that we teach, no? So this is the way it should be. Sana po magtulungan tayo. You can invite all your friends. Meron po tayo, mag-uumpisa na po tayo ngayong July 3 sa ating Zooms 5 to 6, yung from the beginning. Anyway, free lang naman yon. And that will run for 64 hours. So we will end sometime in November. This is patterned after the PITAC guidelines for your, and we hope, but nakikita ko, kung nakita niyo yung timeline, sana po by September, when we all submit your applications, pag alam nila LAM, then you're really good. And welcome. I hope you welcome the new management of LAM. And we're very happy na may tiwala kayo sa amin. Sa totoo lang, hindi pa namin napapakita yung pinakagaling namin na joke. We're going to share with you kasi ang gusto namin, lahat ng LMTs, lahat ng mga naturopaths will join LAM because we have a big event come 2028, 2027 or 2028. We hope to be able to have the second international convention. That means we will invite other countries to join us. But before we do that, kailangan meron tayong branding, no? Dr. Palangka and I have been really thinking of helping the drug addicts, no? So we're coming up with a 2-year protocol for drug addiction. Nakikita ko naman that the present administration is very, medyo yung approach nila for drug addiction is mas may puso. No? I'm not saying na hindi maganda yung last time, pero ako kasi naniniwala that there's always room for a second chance. No? So we have that big plan. We're going to do drug addiction protocol by LAMP. It's going to be like 2 years, and we need a very, it's something very challenging. I'm actually coordinating with somebody, a classmate who has been a drug addict for 43 years. He's based in Zamboanga. Hindi mo na siya magpapakita, but nakita ko kung gaano siya of course, kailangan alam natin kung, ano yung pinagdaanan niya. Can you imagine 43 years? Yun. And buti nag-pandemic, medyo nakatulong din. And he's spent so much for rehab. And sana maintindihan din natin yung mga ganitong ng society natin. I'm not talking about drug addiction alone, but about addiction in general. Addiction to food, addiction to internet, addiction to sex, everything. Craving. That can only happen if we are a big group. So we are very grateful to have you with us, and yun nga lang, mag-effort talaga tayo because the present administration of LAMP doesn't believe in shortcuts. And we only believe in excellence, in global competitiveness, and analytical thinking is paramount to be able to stay with us. Hindi po kami nangangagat, hindi po kami nanlalait. Ang gusto lang namin is we train you as trainers. 'Di ba? Kasi kung magtuturo ka din, you have to be very good. No? And this is what I can guarantee you. There is a very bright future kasi po ang trend ngayon ng wellness is iba na, no? Ang labanan ngayon is paramihan ng skills. That is why, as head of the Education Department of PAI for the convention, this October 28th, we are revolving around the theme of wellness in the modern era. No, it's yung mga, kaya we will be providing a lot of out-of-the-box techniques para medyo mas exciting, di ba? Kasi yung paulit-ulit, puro traditional, mukhang, kasi nagbago na ang panahon, di ba? Di ba, Dr. Sam? Oo. O ngayon, meron ng mga bone setting, mga nihila yung ulo. Grabe. Ano ba
Oo
yun?
nga po, yes Doc, totoo yan. At in fact, ako din, pumasok na rin sa bone setting.
Gusto ko natin yung bone setting eh. Parang, uy ko, grabe, andun na, no? Di ba? All the while, I thought, kailangan you have to be an orthopedic surgeon or PT or something. Ganun na po, no? So ang akin lang is, for people to really believe in you, you have to have skills. And ang importante dyan is how you deal with patients. Kailangan naniniwala ang pasyente sa iyo, and importante is, they get value for their money. Okay? So maraming salamat po kay Sir Henry. I hope you can join us, and hopefully when you all become CAAs, you will all be part of the teaching faculty, the teaching staff, no?
I'm hoping for that. So,
Yeah.
this is
We
my
should
first time to join with you. Kaya hindi pa ako nakasimula ng basic talaga. I need to start from the grassroots level.
Okay, you start from the grassroots,
Yeah.
you attend o kung hindi mo kayo maka-attend kasi alam ko yung iba sa inyo, ang daming pasyente, you can subscribe to Acupuncture Matters. Medyo happy ako dahil, alam niyo na kung bakit happy. But anyway, natutuwa ako dahil meron palang, mga hindi taga-ate na nanonood. And I have been receiving good comments. Diba? So kahit, kaya this is very inspiring. Kaya I'll do my best. And sana magdumami tayo. Now let's clone ourselves. And para naman kasi alam nyo ba yung aming mga counterparts, there are medical doctors who don't believe in Acu. In fact, my sister, who is an ophthalmologist, she would always ask me, how's your voodoo? So can you imagine? Parang, oh, okay, sige, tingnan natin. Kasi sinong may kasalanan nito? Kasi hindi natin masyadong sineryoso. And we are very fortunate to have Dr. Webb Lim. Ang laki ng utang na loob natin sa kanya, kaya tangkilikin nyo lahat ng lectures niya. And for those who wish to make habol, magbibigay ng lectures si Dr. Webb starting on July 6,
July
30, 20, and 27. Lahat ng general, mga basic principles, i-compress. In fact, if I'm not mistaken, this coming July 6, he will teach about the
Yes,
purpose of TCM, and then on
TCM,
the 15th, he will talk
the
about
high.
yin yang, 5 elements, yung ganon, and on the 20th, kalimutan ko ano pa yung iba, parang channel theory, yung meridians, and he
Military
will also
battles.
teach you how to locate the points. Kaya if you have the
Yes,
time,
Doc.
please feel free to, baka puro na lang tayo, puro lang tayo ganito. And also, during my recent meeting with PTAC, they told me, when are you going to do the practicum? Kasi I told them that we meet like 10 hours a week plus 2.5 hours. 3 oras na nga for the assessment. Remember, we have the weekly assessment. Okay, paano ba yun? Di ba pinapadalan ko kayo ng videos na sa tingin ko naman pinapanood nyo minsan, di ba? And also the notes and also the malalaman lang naman yan But I always believe that the assessment is the best part of the nakikita ko kung talagang binasa nyo, no? And so far naman na-impress si Sir Henry, so I guess wala tayong problema doon. Yung iba lang kailangan lang talaga mag-level up. I understand naman na busy kayo, but I really want you to really focus more on classification of the points, no? So we'll do our best to really, kasi nakita ko yung bagong guidelines. I don't know if you already compared our curriculum with the ano ba to, syllabus, no, na binigay ng PTAC. So, kung nakikita nyo, I would always align the basic anatomy and physiology with the points. Kasi naman ang reason bakit kailangan nyo maaral yung anatomy, di ba? O, di ba maganda? At the same time, diretso ka na sa location. Then I would always merge the clinical. We will also teach you how to look at the patient, how to see patients, how to extract history, and then i-combine natin with the TCM way. And I'm very confident that in the future we can advance the lump medical acupuncturist tag for those who are interested. So pag sinabi mong medical acupuncturist, you were trained to be on equal footing with the medical doctors in the hospital. That's actually one of the dreams of the late Dr. Palanca. So sa tingin ko naman mukhang magkakatotoo. And hindi po mangyayari ito pag we don't have your trust. No? Okay, so Ma'am Jelaisa, are you happy?
Yes, Doc, we are happy.
You should be happy. Okay, so sino pa ba?
Should be happy.
Maraming salamat, Sir Henry. Napilitan kitang mag-attend kasi proud na proud ako kasi super galing nila, no? All of them are super galing. Yung iba mukhang inantok lang siguro. Oo. So that's the way we do it in love. So I hope you can spread the news to all our friends out there. We don't discriminate, no? Sa totoo lang, it's better to pretend low profile rather than pretending that you know everything pero wala naman palang laman, no? So, hindi naman kami mayabang. Medyo, ano lang. We focus more on, kasi pag wala po tayong basic, we would never be able to have a very good diagnosis. So, without a good diagnosis, you cannot help your patient, no? So, rest assured that we're going to teach you all the skills that we could share with you so that we can be at the top of our game, no? Ganun na po talaga ang labanan. So maraming salamat po. Go tayo for global competitiveness para magkaroon naman tayo ng mga friends outside the Philippines. So let's show them that the Filipino way is, the Filipino acupuncturists are going to shine, no? So maraming salamat po. Unless you have anything to say, Dr. Sam? Wala na?
Nothing else, Doc. Thank you.
Mag-alas
Thank you, Doc.
Okay, maraming salamat po. And meron pa tayo next week, week 17.
Yes.
Okay? Thank you, Sir Henry, for joining.
Thank you, Doc.
Tuloy kita
Inviting.
na mag-attend. Okay. Sir AK,
Thank you, Doc.
ano pa ba? Ma'am Annalyn, nakikita ko nakangiti parate.
Thank you, classmate.
Yeah, ang galing mo, Sir AK, ha? Pwede ka na mag-lecture on constipation. Ma'am Darlene, pakita mo sa mga taga-Okada na talagang sulit yung ibabayad nila. Ma'am Lane, thank you very much. Ma'am Lynn, thank you for really bringing to my attention na medyo pangit yung pagka-ano ng PDF. Sino pa ba? Sir Michael, my condolences, no? And also Ma'am Teresita Sumile. Tatawagan na kita next time. Maraming salamat po sa lahat. Good night, everyone. Bye-bye po. See you
Night.
next Friday. Bye-bye. Thank you po.
You.
Good night.